welcome to the October 12th, 2021 meeting of the Lane County Board of Commissioners. This is a full docket today, so we will get right underway. Number one on our agenda, are there any adjustments to the agenda? Seeing none and hearing none. Item two, Mr. Rickoff, is there any emergency business?
Chair Bernie, there's no emergency business.
Although it does seem like all our business is emergency business these days. Thank you very much. In that regard, item three, County Administration, COVID-19 response and recovery. And we have with us, I believe, Steve Adams, Incident Commander, and Dr. Jocelyn Warren, Public Health Manager, to provide that report.
Chair Bernie?
Yes. Oh,
if we could go to public comment first, that would be great.
I'm so sorry. I am so sorry to everyone. I apologize.
You're testing me.
No, I'm demonstrating how much coffee I've had this morning. To the public, forgive me, we are now on item three, public comment, as the chair desperately attempts to regain his composure. To the public watching this meeting, when you registered to watch in this temporary format, you were registered in our system as attendees. Attendees are webinar participants who are audience members viewing the meeting. Your microphone and your webcam are automatically muted as attendees. At this time, however, when our moderator, Ms. Jones, calls on you, because this is the time for public comment, you will have up to 3 minutes for public comment. When your 3 minutes are up, I will let you know. We'll provide you up to another 15 seconds, and then you will be muted, so hopefully you can organize your remarks accordingly. And the next name will be called. You can then continue to watch the webinar as long as you choose, and we will give everyone who wishes to present public comment an opportunity to do so. So at this time, Ms. Jones, do we have anyone wishing to make public comment to the Board of Commissioners?
Thank you, Chair Bernie. Yes, we do. And at this time, if you would raise your virtual hand, it will put you in the queue for public comment. Please only raise your hand once, otherwise it'll take your hand down. At this time, I will call upon Daniela Marino, followed by Mike McFadden. Daniela, I will unmute your microphone and you may begin your public comment.
Good morning, everyone. This is Daniela Marino, and as usual, I oppose the government mandate. I'll be shorter today on my public comment. I'd just like to provide you an update on the numbers that I've been reporting, that I think they're showing a story of success with COVID. And those numbers are that we are still at a 99.98% of survival rate. That means from everyone that got COVID, 99.98 people have survived in Oregon. I think that's a very big number, and I don't hear people talking about it. So that's why I keep insisting on it. And we are still at an 89.5% of all deaths were people who had 60 years old or more and had pre-existing conditions. Also, I think this is a very important number that I wish I would hear people talk about more often, because again, these two numbers are a story of success of the pandemic management. Of course, I pull these numbers weekly and I'm keeping track. And these mandates, the more I look into it, the less sense they make. Also, I got curious because there's 2 deaths reported of children with COVID. That doesn't mean that they died from COVID, but they died with COVID, who were between 0 and 9 years old. And I got really curious and I had to do a lot of work to figure this out, but I found out that those 2 children had pre-existing conditions. Also very important for you to know. And then 3 teens between the ages of 10 and 19 died with COVID. And I found out of the 3, I found 2 records in the OHA data. So there's 1 record that is missing. I'm gonna try to figure out what's up with that. But from the 2 records that I found out of the 3, they had pre-existing conditions. Please don't ignore this information. Please help us stop the vaccine mandates. A big majority of the population is already vaccinated, and they keep moving the target posts on the what massive or what herd immunity, as they call it. So anyways, keep in mind that coercion is not consent. These mandates are unconstitutional, and we don't want them. So thank you, and I hope that you're getting my emails. I hope that you're looking to the information, because I'm working really hard. It's really not misinformation. It's information that comes from your data, and I really hope that you're honoring that. And I'll be happy to jump on a call and give you everything I got. Thank you, and have a great day.
Thank you for your public comment. Our next presenter is Mike McFadden, followed by Melanie Stanley. Mr. McFadden, I will reset the timer and unmute your microphone, and you may begin your public comment.
Good morning, Chair and Board. Can you hear me all right?
Yes.
Okay, good. I can't see anyone, so thank you. Being this is the morning after Indigenous Peoples Day, I wanted to come make these comments before the board this morning. And in light of the long history of empty platitudes and patronizing words and broken promises that Indigenous people have experienced, I really wanted to take the opportunity to urge the board to not let, designating Indigenous Peoples Day as a holiday be the last step you take, but rather sort of an opening step on a pathway towards reconciliation, towards inclusion, and towards accountability for the terrible history of mistreatment and abuse towards the Indigenous peoples of Oregon. In particular, I have one specific thing I think that could be a good next step towards those goals. And I know that many other people have advocated for this probably more eloquently than I can, but is to urge the board to, again, bring up the consideration of changing the name of Lane County away from a name that honors General Joseph Lane. I really wanted to take some time this morning to read some quotes. I went through and actually read all the letters and papers of Joseph Lane. And so I wanted to read some quotes from him just to give you sort of an idea about, this person and why we shouldn't spend 365 days out of our year honoring and acknowledging this person while we only spend one day, sort of honoring Indigenous peoples. So I guess I wanted to start by, pointing to a speech that he gave in the House of Representatives in 1856, where he begins by talking about his, quote, desire to reclaim these untaught children of nature, and going into how, quote, the colonists were sent there for the purpose of teaching them the habits and customs of men in a higher and more improved social position. And he says, quote, that he acknowledges the right of the white race to occupy and improve the lands of the natives. And he says that he knows of no one who would deny that right. He then goes into the, quote, treacherous and ungrateful character of the Indians of Oregon, end quote, and says, quote, the people of Oregon have borne with patience and forbearance the injuries and insults of the inferior race by which they are surrounded, end quote. In addition to all of the horrific sort of genocidal pogroms that he inflicted on Native Americans, he also had a terrible sort of racist view on African Americans, and he tells his Confederate soldier son to, quote, give the blacks all the trouble you can, end quote, and to, quote, burn all the letters you received from me, end quote.
That is 3 minutes, 15 more seconds, sir.
Okay. He was receiving letters all throughout this time that, the resources of the land was so rich, and that's why they had to quiet the title of these native peoples. So, I'd really just urge the board to revisit. I know that it's, not popular, and it's not easy, but it really is the right thing to do, and we really shouldn't be honoring Joseph Lane any longer in today's day and age. I'm going to just read one last quote, and then I'll be done.
Thank you for your public comment, Mr. McFadden. We will now move to Melanie Stanley. Melanie, I will unmute your microphone, and you may begin your public comment. Melanie, I do show you are self-muted.
There we go. Hopefully that worked. Thank you, Chair and Commissioners, for letting me comment this morning. Hopefully everybody can hear me. I'm here today to just kind of, I guess, give some comments on current Holiday Farm fire stuff. Land use and planning has been a huge challenge for all of us up here. I own, or my family owns, a couple of spots here in the middle of Blue River, which are teeny tiny postage stamp size lots. And we are facing some fairly significant challenges getting rebuilt because of some right of ways and setbacks that we're being required to adhere to that are unreasonable, really, at this point, because my original home sat within the setbacks, and the only part of my new house that's setting anywhere different is the back side of my house in an alley that is not usable or used by anybody. And so there needs to be some provisions made. I know that there are laws, I know that there are rules, and I know that there are state mandates, but Lincoln County currently has 78 new homes. The McKenzie does not have that many. So the interpretations that Lane County is using on the land use and ORS that are being used to allow us to build our homes back, the interpretations are different than in other counties. And I understand that Lane County has a lot more stringent rules in a lot of ways, but there has to be something done. And it's only going to come from you guys and working with land planning and land use to be able to make it so that people can actually build their houses back and without all of this fuss. I'm not saying that we need to allow people to like rebuild houses right on riparians or, in the middle of rivers or, in areas that they just shouldn't be, but there has to be some wiggle room. Like I said, in Lincoln County, and only because I'm specifically associated with some folks from Otis, they're being allowed to put triple wide houses back in places where there were single wide homes with no problems. They're not being the 10% adherence with House Bill 2289, any of that other stuff. So there's got to be some kind of different interpretation that can be allowed so that they're not having to argue as much or have as many challenges. So I'm hoping that maybe we can look at something different. And that's kind of where I'm at with it, and not have people have to spend $3,000 on a 3-foot variance to be able to put their home back. So thank you for your guys' time today.
Thank you for your public comment. I do show Harry Sanger has raised his hand for public comment. Mr. Sanger, I will unmute your microphone. Let me reset the timer. And Mr. Sanger, I do show you are self-muted. There you go.
Thank you. I see that we have a busy schedule today, so I'll try to keep this brief. We now have more COVID deaths in 2021 with the vaccine than we did in 2020 before the vaccine. This should warrant a front page news story from the New York Times, yet barely a whimper in our mass media. This is why people question what we're being told. This seems a blatant politicization of public health. Do you think if Donald Trump was in office, we'd be doing anything right now except drowning under this story? Or from a KGW8 news story yesterday on Kaiser Permanente workers authorizing a strike. I quote, "Again, Oregonians must listen to the concerns of nurses or other healthcare workers who have been saying for years." Wait, did I read that right? Yes, have been saying for years that staffing must be a priority, or we will see a worsening of already crisis level problems across the state. So when you tell us the unvaccinated are causing hospital capacity issues, well, it appears what really happened is that increased hospitalizations from COVID and with COVID brought to light existing staffing shortages. While it is great to see an increased focus on justice, do we really need to destroy society as we know it to get there? Not to mention, social justice only seems to matter when you support the ends. Vaccine mandates are biased against marginalized groups, including Black Oregonians, Hispanic Oregonians, and in honor of yesterday, Indigenous Oregonians. While white Oregonians are over 70% vaccinated, these other groups range from 52.2, barely half, up to 58.7%. So your vaccine mandate seems a little racist. These numbers come from OHA, Age, Race, and Ethnicity Vaccination Rates Dashboard. I've been warning that the fallout from our dramatic COVID response may end up worse than the results of a less oppressive approach. Now that seems to be happening. Shipping vessels are tied up at ports around the world, causing supply chain issues. Southwest is grounding flights because of vaccine mandate staffing issues. And European nations are banning the Moderna shot for people under 30 because the risk of vaccine injury is greater than the potential harm from COVID for that demographic. Oregon legislators are now in the news for petitioning U.S. Attorney Scott S. Fogg to approve a grand jury investigation into how the pandemic is being measured. I appreciate the public service you provide and hope that we will continue to learn from our mistakes and openly incorporate new information as it comes in. I cede the time. Thank you.
Thank you for your public comment. At this time, I do not show any other hands raised for public comment. If you did register for this meeting and wish to present public comment, please raise your hand now and I will call upon you. Chair Bernie, I do not show any other hands raised, so I will return the meeting to you.
Thank you very much. And thank you very much to everyone that provided public comment on a range of issues. This is the opportunity now for commissioners to respond to some of the items you brought up, or to respond to other issues and remonstrances. Commissioner, I see Commissioner Buck's hand.
Thank you, Chair. I have a few things. First, I wanted to respond to some of the public comments. I appreciate Mr. McFadden's discussion on the name change of Lane County. It is on our ongoing work session items. We have not been able to get back to it, but it is indeed an issue I know that we all care about, and eventually we do need to pick that topic back up. Also want to acknowledge Melanie Stanley. She is our unofficial mayor of Blue River. She has some very serious points that make a lot of sense for us to consider. And part of those we acknowledged last week when we discussed variances, and know that we'll be picking that topic up. In the meantime, some people can't wait for those discussions to be had. They're right in the middle of trying to place homes that are on order or have contractors waiting, and instead can't proceed until there are some discussions that we need to have here at our board level. I don't know how speedily we can get those going, but it is really critical that we do, because folks like herself really need to move forward with building. So I urge us to get that on our agenda as soon as we can. And along the lines with housing, we had AOC meetings yesterday, and for those that attended, you may have heard that in the Transportation and Community Development Committee, we had Deschutes County speak on behalf of Interim housing, and a letter that they sent to the DLCD regarding that. There is a deadline of being able to put in public comment to the DLCD on advocating for additional leeway for supporting interim housing on rural lands. Staff has a letter of support that we would they would like us to see signed by that Friday deadline. It's just 2 paragraphs, but there'll be multiple counties writing in to support a larger discussion on this particular issue. I'll have staff email it to everybody today and hopefully pick this up as other business at the end of the day, so there is enough time for everybody to read it in advance. So thank you very much, Chair.
Thank you, Commissioner. Other commissioners? Any interest? I see no further commissioner remonstrances. So, Commissioner Bozovich, am I misinterpreting? Did you want to speak?
I was trying to decide if I wanted to or not, but I think I will real quick. First, I want to say to Mr. McFadden that I agree with him, and I've been supporting the idea of changing lanes for quite some time. And in fact, I was recently reading quite a bit about Joseph Lane as I was doing some research about our indigenous people and the relationship between him and the indigenous tribes. So I completely agree with you on that. Melanie Stanley, I just want to say that last June, I asked this board to provide direction to our land management staff to take the most liberal interpretations of House Bill 2289 and failed to get majority support to that. So I will just say that I appreciate the predicament you're in. I wish we had a little bit more flexibility, and I just hope that we can continue to work towards being as liberal as possible and helping fire victims get rebuilt. And finally, Mr. Sanger, I will be bringing up the issue of disproportionate impact of vaccine mandates under our COVID-19 item. And hopefully I will get support from the board to take away the local mandates based on that issue. So stay tuned.
Thank you, Commissioner. Yes, Vice Chair Farr.
Thank you, Chair Bernie. I was not going to say anything, but in response to some of the things that Commissioner Bozovic said, I joined Commissioner Bozovic in asking staff to take a look at the way to make things happen, as opposed to finding ways to slow things down. I've been in contact with a lot of people who are struggling to get their housing, whether it be small temporary housing or permanent housing, through the permitting and approval process. It seems that we, from their point of view, we don't try to speed things up, we try to slow things down, and we have multiple cases of that. And I think it's really, we have an opportunity. We have an opportunity to really spread our wings and allow things to happen in ways that normally we may not, because we are letting people get back into their housing. This is a chance to do this, and I'm not 100% certain. In fact, I'm not even close to that we are doing it. And I joined Commissioner Bozovic in asking for a liberal interpretation of how we can allow people to replace their dwellings and to get back into the housing up in the Mackenzie Valley. And thanks, Jay. Thank you for bringing that up, and I'll tag along with you on that at any time.
Thank you, Commissioner. Yes, Commissioner Buck.
Thank you, Chair. I do want to ensure when the public has commented and we are giving responses that we're completely accurate. There was no opposition to a liberal interpretation. We actually had a subsequent meeting with land use who presented how they were interpreting those new rules from the legislature, and that was presented to our board, and we did not have opposition at that time to the way in which they were interpreting it. Thank you, Chair. Just wanted to clarify.
Thank you. Yes, Commissioner Trieger.
Thank you, Chair. And good morning, everyone. I just want to note two important things. We had Mental Health Awareness Day on Sunday, and so in the interest of time, I just want to say to anyone watching that if you need help, there's help out there, please get it. And in these incredibly tough times, and as we head into darker days of winter, I know more and more people are really wrestling and struggling to stay, to maintain their equanimity. So just encourage folks to reach out and get help if you need it. There's no shame in needing help. We all need help at times. And also want to celebrate and honor yesterday, which was Coming Out Day, and say to my community, welcome out if you're out, and if you're not yet safe to be out, support you in gathering community around you until you are ready to do so. And finally, in response to Mr. McFadden's comments, before I took office, I actually gave public comment to this board. And when we get to that item on our agenda around name change, I'll be looking for as broad an opportunity to broadly think about how we do naming of county assets, whether that's roads, bridges, parks, buildings, or the county itself. I think when we rush to, pardon me, when we rush to one specific answer, we often lose an opportunity to have a deeper, richer conversation. And so I'm very much looking forward to when we can make the time on our agenda to have a conversation, not only about what is named and for whom and its significance, but who is involved in the process of identifying what the right and best naming opportunities are for our county moving forward. So thank you for flagging that issue, putting it back closer to the top of the list for us. And as Commissioner Buck mentioned, just assuring you that it is on the radar and on our long list of things that we are committed to getting to. Feeling really great that we did finally acknowledge Indigenous Peoples Day as a holiday here at Lane County, and that later we'll be getting an update on doing our due diligence and making space and engaging the right partners in moving forward on some of our next steps on that topic, particularly on the subject of land acknowledgement. So thank you again so much for your care and attention to that, Mr. McFadden, and to everyone who spoke and provided public comment this morning. Thank you.
Thank you, Commissioner. I'm going to make a statement, then we're going to move on. I would just like to say to those listening and to those making comment tonight, thank you. Rest assured that everybody is doing their absolute best under difficult circumstances, both to help, but obviously, I mean, I lost a part of my home in a different disaster. So, I mean, obviously the people who are immediately and directly impacted are experiencing the worst pain, and we're aware of it. To suggest that the staff of this organization and this board hasn't allocated as many resources as we can and will continue, we're always going to fall short. Anything we do is not going to be perfect. All we can do is constantly try and do better and better and better. So as it relates to the wiggle room to enable people as easily as possible to rebuild and rehouse, whether it relates to public health concerns and the various pros and cons of the best way to get us all healthy and not wearing masks and back to normal. I just want to assure the public watching that it's not as if there's any evil intent anywhere. We're all doing our best. And I invite you not only to listen to the reports we are about to get on both of those issues, two of which were discussed today, but I also invite you to look at all of the public documents that document the expenditures, the fights with FEMA for housing, the dipping into reserves, the doing whatever we can. And there's always so much more to do. So thank you so much for your comments. And commissioners, only because of the day's agenda, with your permission, I'm going to move on. The Board of Commissioners now is going to take a recess, and we are now convening the joint meeting of the Board of Health and the Board of Commissioners. On this agenda, are there any adjustments to the agenda? Seeing and hearing none, is there any emergency business? Seeing and hearing none, we have convened into this joint meeting so that we can hear and discuss the status of COVID-19 response and recovery, because the incident command for all of that, whether it's dictates from the state or from the federal government, fall upon this county to coordinate. And we have with us Mr. Steve Adams, Incident Commander, and Dr. Jocelyn Warren, Public Health Manager. Thank you. Please.
Good morning, Chair Bernie and Commissioners. It is a great pleasure to see you all on this Tuesday morning. I have for your consideration this morning perhaps a bit of an abbreviated presentation of what I typically do every week. And with your indulgence, we'd really like to focus on some of the work that we were able to document in a recent demonstrated progress report that we submitted to OHA around vaccine equity issues here in Wayne County, largely over the summer. But first, looking at our 7-day case rate per 100,000, we continue to see an improvement. Indeed, yesterday's numbers bring us into the upper 160s for the first time in some time, dating back to really kind of the upper end of this surge. In our cases have on a daily basis have been averaging just over 100. This morning we had 115 cases reported in the last 24 hours. That brings us to 26,678 cases. We are currently tracking 551 individuals as infectious in Wayne County. That's between days 1 and 10, obviously, and that is a reduction of 23 in the last 24 hours, and a significant improvement over what we were dealing with as twice that number, or more than twice that number, just a few short weeks ago. We currently have 48 Wayne County residents in hospital, 17 of whom are in ICU beds. And we have reported 3 new deaths in the last 24 hours, bringing us to 286. So as we kind of calibrate the case trend that we have experienced since the beginning of August, we have recorded 11,505 cases in Wayne County. That's 43% of all COVID-19 cases reported since March of 2020. And since the beginning of August, we've also reported 111 deaths, and that is 39% of our death total. So certainly the Delta surge has been challenging for us here in Wayne County. We now are hopeful and absolutely optimistic about the near future as our trends continue to decline. But putting this in context, as you see in the epi curve, outside of that gray bar on the far right, which is still the period in which we are collecting test results, we still remain above where we were in the winter. Moving then to our current vaccination final outcomes that we're trying to achieve. Over the last 2 weeks since I last presented to the board, 2,393 individuals have stepped forward for their first dose, joining the at least partially vaccinated status. So 65.6% of our entire population now has received at least their first dose. And we have 74% of our eligible population, that is individuals 12 years and older, who have at least their first dose, if not fully complete. And that leaves us with 88,418 individuals estimated who are eligible and have not yet stepped forward. So you'll see in the tracking on the right-hand side of your screen, the bump here in doses administered, and that obviously is the boost dose experience that we have seen over the last 2 weeks with our Pfizer third shot or boost dose recipients stepping forward. We continue to see more boost activity than we have seen primary doses being administered. So with the 2023, almost 2,400 new vaccinations over the last couple of weeks, it's really almost 4 times that amount in terms of total vaccinations received during that period of time, with the difference being the Pfizer boosts. We have obviously continued to monitor our federal partners at the Food and Drug Administration. Later this week, their advisory committee will be hearing testimony on boost doses for those who received the Moderna vaccine and boost doses for those who received the Johnson & Johnson vaccine. We anticipate that those may be approved. We're going to monitor those meetings to determine, and will be prepared to begin offering those boosts as well at our MassVax clinics that we have opened in the fall. Everyone is very focused, obviously, on the Pfizer vaccine emergency use authorization, for individuals 5 to 11. So we now have had Federal Register notices. The Food and Drug Administration's advisory committee will be taking that up on the 26th of October. That is followed by the CDC advisory committee during the first week of November, and we anticipate that moving forward. We have learned from the filings that the dose offered for 5 to 11-year-olds will be a smaller dose. In fact, 1/3 of the dose offered to 12 plus. And we now understand that Pfizer will be packaging this vaccine separately from the Pfizer that we currently have in store. Further, we've been advised that this is a new production line and we will be experiencing shipments coming from a centralized location allocated on a pro rata share to the states and then within each state to the localities. And so we have been advised to anticipate that there may be some delays in getting that vaccine into local hands and getting shots in arms once it does become authorized. So we, I think, as we consider the regulatory timeframe and what we're learning about the production process, we're now kind of resetting our timeframe for about mid-November for first doses becoming available to the 5 to 11-year-olds. So moving then to from the kind of status quo update where we are at the moment on some of our vital operations, I want to pause and take a moment and cede the podium to my colleague, Dr. Warren, to really kind of set the frame for your understanding of our report out with respect to our COVID-19 vaccine equity efforts within this response. The fact that it's rooted within longer standing Wayne County public health policy and efforts to address inequities. Dr. Warren.
Chair Bernie and commissioners, thank you for this opportunity to talk a little bit more about our vaccine equity progress. I wanted to note, and Steve, if you want to go to the next slide. I want to note that I think it's important to understand that a lot of this effort has grown out of the modernization work that we've been doing in the county and in the state. In 2015, as a reminder, Oregon adopted the foundational model of public health. And what really sets this model apart from other models that have been adopted across the country is identifying equity as a foundational capacity. So that really makes Oregon's model unique, although very much more of it is in common with a lot of the work that's being done at the national and other states to bring public health into the 21st century. In 2017 and 2019, there was $5 million allocated to public health to enhance communicable disease. We here locally were able to dedicate a half-time person to advancing equity in our community. It wasn't a lot, and we knew that much more was needed, but it was a start. And we had a really terrific staff person who was able to complete a health assessment and begin rural engagement. Rural engagement was really identified as the place that we needed to start, particularly the Oak Ridge and Cottage Grove areas. So she spent a lot of time thinking and planning for that engagement. We're also trying to align that with some of our climate mitigation engagement as well around emergency preparedness. In the 2019-2021 biennium, the legislature adopted $15 million. So we were able to increase the FTE for that single person that we had, and she began implementing the plan in Oak Ridge and Cottage Grove. Hey, Steve, you can go to the next. Thank you. So the exciting news, and I don't want to spend too much time on this, just wanted to note that it is all kind of rooted in the equity work that we've been doing for a number of years. But with the $60 million investment in public health now from the state legislature, health equity has a much higher profile and is a much more central focus of the work that we're doing. We had initially begun increasing outreach into the Cottage Grove area. particularly with the CBOs. There was a lot of work done with the mom speaking community and some of the other Indigenous groups in the community, and around the Family Resource Center, and some really terrific partnerships with the Rural Organizing Project, for example, and Centro Latino Americano. As soon as COVID kind of came to the forefront in March, all of those efforts were redirected to those areas to identify sites that could be used later for vaccination efforts, and to start the outreach effort around vaccination, and to do some really good outreach and education with those groups to kind of set the stage for the later work. So we partnered with food pantries and other groups just to create a presence and the expectation that public health is there and could be trusted in order to really be available and be effective when vaccination was eventually available. And all of that now has kind of culminated in this, I think, really exciting development, which is the Community Partnerships Program, which this will build on all the work that we've done during COVID thus far, and really help us sort of take the work that we're doing in communities to the next level. We have 3 dedicated FTE, and Mo Young, as she let you know previously, has been hired as the supervisor for this new program, because of course she can build on all the terrific relationships and connections she has in our community to further extend this work. We will continue to address COVID through vaccination and testing and recovery in communities, and then be able to leverage that work to do a lot of other prevention work in communities, and co-creating and planning and partnerships in order to address other health inequities. So it's been a journey, but I think that we have finally arrived at a place where we can really take advantage of some of the really great work that's been done previously by staff here, and really continue to those relationships with our communities, so that it's a much more collaborative and responsive effort. So just wanted to kind of tee that up before moving back to Steve to talk about our equity report and the really terrific work that the COVID team has done. Thank you.
Thank you, Dr. Warren. I appreciate that. And so this board may recall, in late May, we had the opportunity to submit a vaccine equity plan to OHA for approval, and receive a proportionate share of $25 million allocation that the governor identified, and the e-board allocated for vaccine equity efforts. Our pro rata share was just over 2.1 million. And we submitted the plan back at the end of May, received the first half of that, and then had a demonstrated progress report due at the end of September in order to release the second half of that funding. So I provided a copy of that report to each of you just at the time we submitted a couple of weeks back, and I'd like to just kind of dive in on some of the findings from the staff analysis. First and foremost, I want to call out some caveats, if you will, some considerations about the data as reported by OHA and reported to us about race ethnicity in Oregon. I think it's really important to understand some of these caveats and as a way to kind of help you understand the data that I will be presenting, as well as the data that are often presented on the state Tableau database. So OHA has implemented a rarest race methodology for estimating the populations in the vaccination space. OHA uses a different race ethnicity methodology for population estimates on the case side. So they're not comparable, which is one challenge. Rarest race differs from the familiar census data in that it, for individuals who are reporting multiple races or ethnicities, they are assigned to the category in which that is the smallest proportion of the total within the jurisdiction. So within Wayne County or within the state of Oregon. So more typical estimates, particularly the way in which alert has been designed, it is a legacy system. It uses census type categories for individuals to say other races, more than one race, as opposed to having folk break out those data. So sometimes the data that are going into alert are not comparable to the way in which some of the data are presented. Some of the other issues is that alert, if you had race ethnicity entered for you when you were a child in Oregon and received your first vaccinations, many years later, those initial race ethnicity categories follow you and cannot be changed after the fact once your record in alert is done. OHA has had shifting population estimates for over time. So at different points along the way, throughout the spring population or the spring vaccination effort, we have had different numbers. So in February, for instance, OHA indicated that Wayne County had approximately 4,000 Black or African American residents. That number under rarest race is 9,000. We've also had lagging data entry and data acquisition from that May time period to now. So this table shows you what OHA was reporting our vax rate as being in May during that time at May. And now, as we look back from the end of September towards what those May vax rates were. Some of this were lags in data entry, as we had a number of VARs, vaccine administration records that had yet to be administered are uploaded into alert. And we also know that many Oregonians receive shots either by federal agencies or receive their shots in other states. And it took time for those data to come back to Oregon. And then finally, unknown or other race represents a significant proportion of the total number of shots. So 12,670 individuals as of this morning, that's just over 5%. So one obviously does not have to disclose one's race or ethnicity at the time in order to receive a shot. So we have a number of individuals who are not reporting their race or ethnicity and thus cannot be tracked. So those are the caveats. It's not to say these data aren't useful. They're useful as a guide, but we know from previous work and much of what Dr. Warren outlined that we do have health disparities. So we use these data not necessarily as a policymaking tool, but rather as a guide to help us focus our efforts. So when we submitted that report at the end of May, Wayne County was still in mass vax operation. We were just about to shut down Wayne Event Center, and we were moving over to our final mass vax operation at Autzen Stadium, which lasted until the third week of June. But at the time of filing this report, we had completed 14 equity-focused clinics specifically at that time. And then in the course of June, July, and August, we were able to complete 163 equity-focused clinics. 75% of the total 216 clinics that Wayne County offered during this period of time during the response. So we offered these equity-focused clinics in three different orders. So one was the standing clinic site method, in which we looked at our disaggregated zip code data, identifying areas with higher proportions of BIPOC community members and lower vax rates, and began a process of and reliable clinics that were happening week after week, so that we could really kind of working with our CBO partners, drive the message out to individuals that they could come and get their shots in a reliable fashion. We recognized that in some instances we needed to go out to where Oregonians were gathering in the heat. We experimented with going to Splash and Echo Hollow Pool, and those turned out to. But far and away, Cascade Middle School, Churchill, North Eugene, and Bob Kiefer have been the areas in which we focused on a weekly basis during this 3-month period of time, and we're able to drive vaccination efforts upward. Secondly, we partnered with our community-based organizations here in Wayne County in terms of working with them and their intimate knowledge of the communities they serve to stand up and deliver vaccination clinics at places that they designated. So we brought the vaccine, we brought the tools, we often brought resources to buy food, lunch, other kinds of amenities to help over the summer and getting vaccination efforts into our targeted areas. And then finally, we were fortunate enough to be able to recruit an incredible roving team that has done amazing work. So just over those 3 months of the summer, these individuals went out, did 70 clinics, invested over 1,300 staff hours, and delivered 1,270 shots. Here they're in front of a small business in which they stood up operations. They engaged with the store ownership and the staff, and were able to over time, convince individuals to receive a vaccination by answering questions. They put together this team and our communications efforts have put materials out to help counter disinformation on vaccine in Spanish, which is an issue nationally. And they, yes.
Mr. Adam, I'm sorry to interrupt you. We need to hear everything you have to say, but just a time check. It's 9:51 and this board has a 10 a.m. time certain, and I'm sure we'll want to ask you some questions. So please continue with that in mind.
Understood, Chair Bernie, and my apologies. I will conclude really and truly just by noting specifically the efforts that this team made to return 7, 8, 9 times to some locations to help individuals who didn't have access to vaccine to be able to have their answers delivered, have their questions answered, and be able to ultimately receive the vaccine. And then finally, we provided a substantial proportion of the funds directly to the community-based organizations themselves to fund vaccine outreach, engagement efforts, and incentives. And at the end of the day, we have seen notable increases in these data from a corrected baseline back in May to where these data stood when we closed the books for purposes of filing our report. And Chair Bernie, given the time crunch, my apologies, I will conclude at that point.
Oh, no, not at all. Thank you. Commissioners, questions, comments? Yes, Commissioner Buck. And then Commissioner.
Thank you, Chair. That was a really excellent equity report, and that really shows all the work that Health and Human Services has gone to in order to reach populations that are typically underserved. So I applaud you for all that effort. Clearly there's more work to do, and that will be ongoing. But I just want to applaud that report. Very well done. I do have one question that goes back to childhood, the children's vaccines from ages 5 through 11. Right now is typically time where you'll ask children to get their flu shots, and adults, of course. Just got mine, so get your flu shot if you need it. And those flu shots for children haven't quite come out yet. And the timing of the flu shot with the COVID shot can be tricky. And what I don't want to see is parents not do one in order to wait for the COVID shot, like not get their flu shot in order to, because you have to have so much time between the two, and then get the COVID shot, and then you'd be well into the flu season. So how do you see that timing working out? I heard you have to have up to a month between the two shots. Is that true?
Chair Bernie, Commissioner Buck, that was initially. There was a time lag required back in the spring when we first were administering these doses between receiving a COVID dose and any other vaccination. That is no longer the case. So co-administration is allowed. So one can could receive both of these shots. And that is, of course, within the adult population. You could receive both shots on the same day in the same visit. We're waiting for CDC. That is the second of the two regulators who will be looking at it. It's part of their job to set the clinical standards under which there will be administration. So we'll have definitive evidence that first week of November. We'll have definitive guidance specifically about co-administration for young kids. But get that flu shot now if you are planning to get that shot. There's plenty of time.
Thank you, Commissioner. And before Vice Chair Farr and then Commissioner Bozovich, Ms. Jones, could you check in and see if our 10 a.m. time certain can wait until 10 minutes after 10 while we're having this discussion, and just let us know if that would be okay?
Yes.
Thank you very much. I'm sorry, Vice Chair Farr.
Thank you, Chair Bernie. Steve, I have no time to do anything other than applaud the work that you are doing in taking the vaccination out to where people are going to be congregating, where it's easy to help people make the decision to vaccinate. I'll talk about two of the clinics in particular. One is what's happening at Cascade Middle School, the work that Lane County has done to help people make the decision in the Bethel School District. Cascade Middle School, you think of it as the old middle school in Bethel, but it's adjacent to Willamette High School, across the field from Malabon School, and within really a golf shot of about 4 of the schools. So the work there is pretty significant. I'd also like to personally applaud Betty Snowden and Lane County for the work that they're doing, getting people access to vaccination right on the downtown mall in Eugene. So Steve, once again, a lot to say, a lot to congratulate you for, not congratulate, to applaud you for. Good work, and pass it along to the team. Thank you very much, Steve.
Thank you, Commissioner. Ms. Jones, have you yet heard back?
I sent a chat message and an email, and I'm just waiting to hear back. Yes,
Okay.
you can wait. They can wait.
Okay, given that, that's great. We have a little more time as this topic deserves. I apologize for the wait, Commissioner. But
Thank you. I'm glad it got a couple more minutes because I think we may need even more time than that to discuss what I'm going to propose. First, I just want to say I fully support vaccination, and I encourage everybody to get vaccinated. I'm vaccinated. My wife's vaccinated. Just want to make that clear up front. But our vaccine equity report clearly describes a disproportionate vaccination rate in minority populations. Whether it's rarest race data or straight up census data, we know there's a disproportionality. That disproportionality comes from a general distrust by a lot of these minorities with our medical establishment due to past structural racism. Whether it's the Tuskegee syphilis work or the involuntary sterilization of Native American women in the 70s. There is a historic distrust by these populations of our medical field, no matter how you look at it. And that disproportionality probably is also reflected in our employee population. So as we look at that, we're not going to change that disproportionality before November 30th. And we really need to seriously think about, as we've committed to trying to eliminate structural racism from all aspects of county government, whether or not an employee vaccine mandate is going to have disproportionate impact on minorities, causing them to lose their employment, and under current state policy, lose their unemployment too. Whether in fact our vaccine mandate for our employees is a form of structural racism. And I would propose that we need to, at the very least, delay implementation, and probably would be best if we just eliminated the policy in general. Because, granted, there'll still be state mandates and federal mandates, but that's not Lane County's policy that's going to continue a piece of institutionalized racism that's happened in our medical environment. Not only that, there's also a disproportionate vaccination rate for veterans of our armed forces, which also comes from a historic distrust built up, whether it was Agent Orange or Gulf War syndrome a lot of these vets distrust the medical profession for good reasons. There's a lot of experimentation that happened on military personnel over the years. So, and when you think about all of the things we try and do where we have veteran hiring preferences, continuing a policy that's going to possibly dismiss veterans at a higher rate than our non-veteran population in our employees really should be seriously considered. We have 10 minutes to talk about this, which I don't feel gives it just time. But I really would propose that the board direct our county administrator to suspend all work on an employee vaccine mandate at the county level. And wait until we can either do the good work we're trying to do with the vaccine equity work and get the other populations caught up and ensure that we're not going to be institutionalizing an additional piece of racism by disproportionately dismissing those folks from their jobs, you know, or we risk long-term damage. I think we also risk the fact that we're going to start seeing lawsuits relative to this. So, you know, for me, you know, the benefit of continuing a vaccine mandate policy for Lane County is far outweighed by the detriment that it's going to cause. And I would propose that we direct the county administrator to suspend all work on a vaccine mandate for county employees at the county level.
Thank you, Commissioner. Are there other, yes, Commissioner Trieger.
Thank you, Chair. I'm thinking about what Commissioner Bozovich just ended with, but I'm not sure that that fits into our public health update on COVID. It feels like board business that we might want to take up later. So speaking to the presentation, I want to appreciate it and thank Dr. Warren and Mr. Adams for the presentation as always. The phrase legacy data really sort of is what's sitting with me. And of course, if we're talking about institutional and structural and historic racism and other inequities, legacy is the key word, right? And so when we build on the foundation of a legacy of institutional and structural racism, right, then sometimes the data that we get reflects that legacy, and that's what's problematic. So what I appreciate about what this report is doing is attempting to sort of unpack and contextualize the data, and that takes time. The corrected baseline is another phrase that's sticking with me, that's doing just that, is working to sort of retool and create a new framework for how we understand how we got to this moment and what we're doing moving forward and who it impacts and how. I really appreciate and am grateful that this board as a whole in various ways has expressed an interest in reducing disparate outcomes. That's the key, particularly around all aspects of public health, and the COVID response is no exception. What I'm very curious about, and maybe you could bring back to us at your next update, is some information about how we even got to producing this report. Because I imagine there was some significant intention and attention and investment made in the process that was undertaken in doing this assessment, in collecting the data and analyzing it. And I'd like to hear more about that process and that investment so that we can understand what went into it and how we might learn from that and apply and assign resources, whether that's money, staff time, a combination, and other resources moving forward in continuing to do rigorous best practice around understanding the community conditions and the health outcomes in our community. So again, really appreciate the report and would love to hear back maybe at our next update a little more about the process of how we arrived at having such a really important resource available to us. Thank you very much.
Thank you, Commissioner. Are there any other commissioners at this time? I would just like to say thank you, Dr. Warren. Thank you, Mr. Adams. Thank you for all the work. I'd like to clarify that the Lane County Board of Health has, or the Lane County Board of Commissioners we don't have a Lane County vaccination policy. We're not requiring vaccination of any schools or any businesses or any external things that go on in Lane County as various state and federal policies do. What Commissioner Bozovich has been referring to consistently is an administrator's decision with our input that should we consider a vaccination policy for the employees of Lane County. So that just clarification. On the data front, it is my belief that data does not speak for itself. It has to be interpreted. And we have heard multiple public comments that relate to a way of looking at the data, which is legitimate, right? You also provide us data, and I would love to see this data side by side as it relates to, yeah, pre-existing conditions do increase one's vulnerability to the COVID virus, and that does impact hospitals, nurses, frontline health workers. I'm also aware, based upon presentations, that regardless of age, the unvaccinated population this is a surge amongst the unvaccinated largely. And I would love to see in your next report some of that data side by side, as it relates to the use of hospital beds, ICU beds, ventilators, and sadly deaths. I would also like to comment that it seems like one death is too many. And as we seem to celebrate that the number of deaths or the amount of trauma, which we can't measure, but as the number of deaths are decreasing, like, yeah, that's a good thing, but people are still dying, right? And so I don't, as we look at data and we see these curves going down, and we see great, but there are human stories. We all have or know them. I know of yet another person since our last meeting that fell to this virus. So that would be my request next time. I know this time you wanted to bring this body up to speed on the equity activity, which sounds like, it is as it should be. And kudos for that. And I'm hoping perhaps next time we can't look at some other data sets side by side that might be illuminating and trigger further discussion. Thank you so much. I'd like to move on. Well, Commissioner Bozovich, it's 10:07, so if you would like to make one last statement, please.
I'll very quickly ask that maybe the board continue this item past after the 10 o'clock time certain. We passed a resolution as the Board of Health to declare racism a public health emergency. I believe the Board of Health is where we ought to be dealing with this vaccine mandate for our employees. Accepting that we could have twice the rate of employee loss from minorities than we would have from our white employees, I don't think is acceptable. And the data points to that. There's nothing that says that our employee population doesn't reflect the general background vaccination rates. And we basically have twice the unvaccinated rate in minorities than we do with our white population. And I think we need to have a serious conversation about that. And this has not been long enough or serious enough and does not need to wait for commissioners' business, because I think we should take the action as the Board of Health. If we could take the action to declare racism a public health emergency as the Board of Health, we can direct our county administrator to remove the employee vaccine mandate as the Board of Health.
Thank you. And as you know, we have an agenda setting session. We currently have an agenda that staff have put a lot of work into. It can always be taken up later. Without further comment, and it is 10:09, and forgive me, I'm just trying to chair this thing. We are now going to adjourn the joint meeting of the Board of Public Health and the Board of Commissioners. Dr. Warren, Mr. Adams, thank you very much for your report.
Thank you.
And we are going to reconvene the Lane County Board of Commissioners meeting of October 12th, 2021. The next item, I believe, if I'm correct, is item 5, County Administration. A, Order 21-10-12-01 in the matter of approving an intergovernmental agreement to transfer real property at Highway 99 and Roosevelt Boulevard to Homes for Good for permanent supportive housing and delegating authority to the county administrator to sign the approved agreement. And with us, and I want to thank you all for waiting, as we still didn't have enough time to deal with the last item, but nonetheless, we are late for your time certain. We have with us Sean Waite, Facilities and Capital Planning Manager, Jacob Fox, Executive Director, Homes for Good, and Paul Solomon of Sponsors. And please provide us your report and remarks and guide this decision, please.
Okay, thank you, Chair Bernie, Vice Chair, and Commissioners. For the record, my name is Sean Waite, and I'm the Facilities and Capital Planning Manager for Lane County. Before you is an intergovernmental agreement between Homes for Good and Lane County for the transfer of property located at the corner of Roosevelt Boulevard and Highway 99. And I'd like to provide some brief background as to how we got where we are today. So the 2018 and 2021 Lane County Strategic Plan includes the goal of pursuing a new location for adult parole and probation. In November of 2019, under Board Order 19-11-12-06, the board authorized the purchase of 3.84 acres of real property located at the corner of Roosevelt Boulevard and Highway 99. At that time, staff recognized that the property was more than what was needed for parole and probation. And so in August of 2020, staff issued a request for letters of interest for the use of approximately 1.22 acres of vacant land. In September of 2020, sponsors submitted a letter of interest in which the response proposed a project in collaboration with Homes for Good to develop a mixed-use facility that would include approximately 50 units of permanent supportive housing for individuals with conviction histories, as well as meeting and office space to provide services such as group treatment sessions, educational workshops, and behavioral health services, and also to facilitate pro-social engagement, including parent-child visitation and mentorship programs. However, I'll let sponsors and Homes for Good provide some additional information on the programming and services in just a moment. As stated in the intergovernmental agreement, the following will need to be completed prior to recording a conveyance. The county will need to complete a property survey and a partition or property line adjustment and have it approved by the City of Eugene Planning Department. And Homes for Good must complete a due diligence investigation of the property to determine it is suitable for use as a low-income permanent supportive housing. And Homes for Good will also need to ensure that there's finance committed for the project. The county has no other financial obligations under this agreement other than the property transfer. As statute does grant the county power to transfer needed property to another agency, as long as the property is used for low-income housing or social services, the board is being asked to consider the intergovernmental agreement for the transfer of property adjacent to the parole and probation building to Homes for Good for permanent supportive housing. And with that, I will turn this over to sponsors and Homes for Good for additional information.
Paul, you're muted.
Oh, I thought we were enjoying a moment of silence. I'm sorry, Paul.
Still muted.
This happens sometimes and you have to log off and log back on and it magically works again.
Commissioner Buck, I think your suggestion was taken. I don't know if Mr. Fox wants to continue. I think Mr. Solomon will be on in just seconds.
Chair Bernie, this is Diana. I have Mr. Solomon's PowerPoint up on my screen if you would like me to, if you want to try to continue with me driving the presentation.
That would be great. Can people hear me now?
Yes.
Oh, great. Chair Bernie, Vice Chair Farr, Commissioners, for the record, my name is Paul Solomon. I'm the Executive Director at Sponsors. Jacob?
Yeah, Chair Bernie, Vice Chair Farr, Commissioners, Jacob Fox, Homes for Goods Executive Director.
Great. And Diane, if you want to move to the next slide. So just a little bit about, actually, Jacob, I think you're going first here.
I was going to say, since the 5 Lane County Commissioners also are Homes for Good Commissioners, I will skip the introduction and pass it to you, Paul.
Super. And I know that you are all very familiar with Sponsors program, but just to give you a little bit of background, Sponsors has been providing reentry services in Lane County since 1973. We currently operate 20 buildings on 7 sites with 119 beds of transitional housing and 124 beds of permanent supportive housing. And this is an area where we recognize there is a huge need in our community, hence our efforts to grow our permanent supportive housing stock in recent years. On an annual basis, we serve 600 people who are homeless and indigent, releasing from correctional institutions, and provide support services to an additional 1,500 people annually, providing behavioral health services, mentoring, employment, cognitive behavioral therapy, and more. Next slide. So we've been partnering with Homes for Good for a number of years, and the first tax credit project we did was at Roosevelt Crossing, across the street from this proposed site on Highway 99, where we built our first men's transitional housing project in 2010. And I just have to give a quick shout out to Homes for Good. In their role as developer, they have brought the technical expertise and the wherewithal to pull off a project of this scope and magnitude that we did not have the in-house ability to do. So we're really grateful for the relationship that we've built over the years. This particular facility has 86 beds for individuals releasing, male identifying individuals releasing from jail or prison. We've also co-located a number of support services, including a behavioral health department, a reentry resource center that's available to residents and to anybody in the community with a conviction history, where they provide employment and housing services. Our administrative offices are there, as well as parole and probation is co-located at that site as well. Next slide.
Great, thanks, Paul. I guess as I was just reflecting on this board order before you over the weekend, throughout my 25-year career, I've worked with probably a dozen different local jurisdictions, and I'm just really humbled and thankful to the Lane County Board of Commissioners and Lane County's administration for the land that you've conveyed to organizations like Homes for Good, where we can actually develop affordable housing in the community, including permanent supportive housing at scale. So just thanks, and you should be very proud of your vision for delivering affordable housing to the community. One of the things that I would say is the partnership between Homes for Good and Sponsors has been transformational for me as a leader and for our organization. To be honest, I've never felt a discriminatory mindset
towards people that have been convicted of a crime. But I was really uneducated about that population when we started this partnership that delivered the Oaks at 14th to the community. Conversely, our staff also were uneducated about this population. And because of Paul's leadership and because of the amazing team it sponsors, it's really changed our organization for the good. And I just want to just acknowledge you, Paul, for your partnership and your leadership in the community. So I do remember, and some of you will remember, being in a neighborhood where the Oaks at 14th was built, being in a room with 80 neighbors and having those neighbors in some cases needing to be educated, and in some cases making discriminatory comments. Over the course of engagement with the neighborhood, we really changed hearts and minds in that neighborhood. And I get complaints all the time for a variety of reasons. I have never received one complaint from a neighbor related to the Oaks at 14th, and I think that's significant. So what we delivered is 54 one-bedroom units. These units exclusively serve sponsors' clients, and there's a very robust resident services and parole and probation presence within that community that has contributed to the success. So with that, I'll just, Diana, we can advance slides and I'll turn it back to Paul.
Thanks, Jacob. So the Way Home is a permanent supportive housing project that is embedded at the Oaks at 14th. We received a $1.3 million planning grant from HUD and the Department of Justice in partnership with sponsors, Homes for Good and Lane County Parole and Probation to provide permanent supportive housing, wraparound services to 125 people who are releasing from jail or prison, actually from prison, who are assessed as moderate to very high risk to re-engage in the system and have no other supports or financial resources. Since the inception of this project, the goal was to serve 125 people. We placed 138 people in permanent supportive housing. We are currently at the 3-year mark. We also contracted with outside researchers from the University of Oregon, the University of Texas, and New York University to do an independent evaluation of the project as required by HUD and DOJ. And at the 3-year mark, having served 125 people, 6.4% have committed a new crime and been returned to prison. So when you consider the baseline for recidivism in Lane County, we have hit the ball out of the park. I mean, this is a really challenging population to work with. And the fact that 91% of them are still stably housed and only 6.4% after 3 years have been convicted of a new crime speaks volumes about what we have known anecdotally, intuitively, and based on our experience, but now we have the data to support it. So this is just another indication of why these permanent supportive housing projects for populations like those that experience homelessness and criminal justice involvement are so critically important. Next slide, please.
Great. So just to kind of kick off, like the land use and environmental and the actual building of the building. Next week, the Homes for Good Board will be asked to approve us to apply to the City of Eugene for home funds, which is a federal funding source that we use frequently within affordable housing apartment communities. So that kind of kicks off us working to secure the financing to bring this project to reality in our community. In January, the Oregon Housing and Community Services Department will release an opportunity for us to apply for tax credits, a 9% low-income housing tax credit specifically. There's also an array of different types of gap funding that's needed for us to fully fund this project. So basically, we will know by spring of next year whether our application has been successful. Given our experience with the 2 prior projects that we've overviewed for the Lane County Board, we believe that our proposal will be extremely competitive. Reducing recidivism rates and being in service to people who have completed their prison sentence is a priority from the state of Oregon, and Homes for Good also intends to create an opportunity for this project to apply for project-based Section 8 vouchers as well. So kind of on the capital funding side, that's a quick overview, and I'll turn it back to you, Paul, to talk a little bit more about the resident services and the common area programming.
Great, thanks, Jacob. So just a little bit about the vision. Oh, can we bring that slide back up? So this project will provide 50 to 60 units of permanent supportive housing in the form of 1-bedroom and studio units. But critically important will be the services that are embedded on the ground floor. We envision moving our reentry resource center from Roosevelt Crossing across the street, in part to have closer access to parole and probation for referrals for people who need assistance with employment, housing, and other supports, as well as financial support. It will also provide much needed meeting space to host family visitation, workshops, employer visits, and a range of other activities. We'll have private offices for our behavioral health staff and case management. There will be a community room that's available for residents. And one of the things that I think is critically important about our projects is that they're a contradiction to what people experience in jail or prison. They don't look or feel institutional, and this project will be no different. In fact, there will be an emphasis on a design that is warm and welcoming and trauma-informed, colorful. So I'm really looking forward to that aspect of this project because I know what a big difference it makes for the people that we serve. And another cool aspect about this project is we'll be able to contract with local artists who are either former or current participants to provide works that will display in the facility. So that's just a little bit about the vision for sponsors at this new project. And with that, I think that's our last slide.
Okay, and with that, are there any questions that we can answer?
Hey, that's my line. With that, are there any questions or comments by commissioners? Oh, I'm sorry, Commissioner Farr, when that PowerPoint's up, I have trouble. I apologize, Vice Chair Farr.
Thanks, Chair Bernie. Paul, Jacob, Sean, my heart beats loud. Greg Rickoff, my heart beats loud when I think about this project and its placement. You know, the property's in Bethel. It's in the heart of what was my city council district when I was recruited by Bobby Green and before I recruited Greg Evans to replace me. It's in the heart of House District 14, where I would serve as the state rep, and it's in the heart of my current county commission district. It's also a few meters from Fairfield Elementary School, which is in the Bethel School District. I serve as board director there. But significantly, what I wanted to mention is when we excavated for Fairfield Elementary School, we found evidence of a historic gathering place for the Kalapuya people. And when the school was built, there was actually a place enshrined in the school to celebrate that discovery and celebrate that the Kalapuya people did, of course, occupy the land initially. As we build parole and probation out there, we're not doing any excavation, but I would assume excavation will happen for this project once it moves forward. And Chair Bernie, I will make the motion to do so when the time is right. And I would hope and expect that we'll keep an eye out for what potentially is artifacts from gathering places from the people who originally lived in what is now the Four Corners area. And I'm excited about that. The other thing I'm going to mention, Greg Rickoff, you and I have talked about this already. A community outreach for Roosevelt Crossing and for Jeffrey Commons and for the Oaks at 14 and for Bothy Cottage was amazing. in gaining the support of the people who lived and worked in the immediate vicinity of those facilities. I expect the same to be the case for this project by sponsors and by Homes for Good. And I hope and I expect to be a part of that outreach as we make this not only acceptable, but celebrated by the people who live in that area, people who work in that area. I'm really looking forward to this. The partnership of sponsors and Homes for Good is one that is for the history bucks. Thank you.
Thank you, Commissioner. I'm not quite sure how you feel about this proposal based on your remarks last night. Are there any? Yes, Commissioner Trieger.
Thank you, Chair. Thank you for this great presentation, and so excited for all of the reasons that Commissioner Farr just stated, and my own history and work with the organization of sponsors. I have one very specific detailed operational question, but I also just want to say I see this as part of our larger work toward helping the community better understand who is experiencing homelessness and why, and what a effective and responsible response to that looks like, because we know the numbers of folks leaving incarceration into homelessness is, I don't know, Mr. Solomon, you tell me what that statistic is. I don't want to misstate it, but it's vastly greater than the general population. Can you just share with us what that number is?
Yeah, Commissioner Trieger. So approximately, according to the Department of Corrections, approximately 50% of the people releasing from custody have no identified housing. And among those that do have identified housing, that includes people going to missions, shelters, and not into stable housing. So we know that the number is well above 50% of people in custody releasing to less than stable housing.
Great, thank you. So again, when I look at this, I see it as one of the critical puzzle pieces in the overall picture of how we as a community are serving essential human needs and addressing the systemic harms that have been done to our most vulnerable and marginalized neighbors. So I'm really excited about it in that broader context. My really specific operational question is just, I've noticed a couple of different numbers in your original letter from sponsors, 40 to 50 units. In the cover memo, it says 50. In the slide, it said 50 to 60 units. So I'm just, and maybe it's just not that dialed in, but that's a pretty big gulf from 40 to 60. And so will these be single? Might there be couples living in the units? Do we have any sense, just more dialed in on how many actual, not just units, but individuals will be served by the project? And thank you again.
Well, I can take the unit number question. So, given where we are in the design phase, we just don't know exactly how many units are possible yet. And the next step is to secure a CMGC contractor, and they're the ones that actually figure out how much the building costs. So, I would say 60s, sort of the maximum amount possible, and we often have to reduce the total number of units just based on what the project can afford. We all know right now the construction industry is dynamic. There's supply issues. We're facing large change orders on numerous construction projects. So we don't know yet, and we will keep both the Lane County Board and the Homes for Good Board posted.
Regarding the units themselves, we're envisioning 1-bedroom and studio apartments that will be single occupancy, which is really where we have the greatest need among the population that we serve. For families, we're able to access Section 8 vouchers and place people on occasion in public housing. So we really see the need for this project driven by the large number of individuals who are single and in need of housing.
Great, thank you for that. And I also just wanted to tack on, I really love that you're calling out the importance of recognizing the value, individuals' value and dignity by presenting them with an environment that is dignified. It's just so important. So thank you for that, and for all of it. And I'm very excited to see this move forward. Thank you.
Thank you, Commissioner. Are there other commissioners? Yes, Commissioner Bozovich.
Thank you. And I just want to thank Paul and Jacob and both their organizations. I just spent 2 days in meetings and numerable time before that reading 33 counties' grant applications for justice reinvestment funds. And only 33 because 3 counties didn't even submit because they just don't have the capacity to utilize those funds. But justice reinvestment basically is funds that are made available by the state legislature, reduce prison usage, reduce recidivism, while still holding people accountable and keeping the community safe. And having Homes for Good and sponsors in our community makes us really successful in the application of those funds. In fact, we were in they split the applications into 3 buckets. You know, those that we had to look really hard at because the counties aren't doing real well. Those we sort of had to look hard at because it was kind of in between. And those we just had to do a cursory review because their numbers are all going in the right directions. Lane County's in that bucket of where everything was going in the right direction. And we were fully funded, including our optional fund that we applied for that's competitive, was fully funded by the grant review committee, still got to be approved by the full Criminal Justice Commission. But it just shows the reputation we have in the state that we've got these incredible programs that are so successful. And I look forward to this new project that's just going to add to that capacity. And just the great work we do in getting people back on their feet and reaching their full potentials as human beings is just such great and important work. And I really just want to say I appreciate that we have both your organizations in our community.
Thank you, Commissioner. Anyone else? Commissioner Button.
I can't say much more than what has been said by previous 3 commissioners. I just want to let you know that I'm fully supportive of this project, and I hope there's more like it in years to come. I think this is a great model. Thank you, Chair.
Thank you, Commissioner. And I play 2 roles here. As chair, I'm always looking at the clock and getting texts from staff and saying you're screwing up because this is going too late and don't forget about this time certain. But then also I'm fascinated, and as is every commissioner, with the content of what's being discussed. So in my first role, I just want to say that we have made up for being late for you because Jacob Fox last week said there would be a 10-minute presentation. And 10 minutes for response, and we've gone over that, but deservedly so. Although when you were making your presentation, I couldn't help but think of the Jerry Maguire movie where Renee Zellweger said, "You had me at hello." Or more recently, Ted Lasso, when Roy Kemp comes back and he said, "You had me at coach." So this is obviously well thought through. I would like to share, rather than a rhetorical, not rhetorical, rather than a remark about how great this is, I'd like to share a story, and then we will definitely, and then the vice chair has demonstrated his authority over me because he did tell me he will make the motion here. But here's what I'd like to share. I have a brother-in-law who spent 16 years in San Quentin. My youngest is 32, and at least every year we visited him in San Quentin, at San Quentin. And while there, we were very aware of the recidivism rate. And to me, living this through my brother-in-law, all recidivism means is when people don't have other options and they don't have supports and they don't have skills and they don't have relationships, they tend to do what they used to do, right? They tend to default to behavior they know. At San Quentin, he went through a sheet metal training program. He came out of the apprentice program. He already had connections to the industry for journey level training and jobs. And he had a family that cared. So he had all of that. I commend you, Paul, for your absolute dedication and passion to try to create those circles of support around others who, like, unlike my brother, don't have those relationships. So I just want to share that one very personal story, and cede to the vice chair, who will make the motion.
Thank you, Chair Bernie. First, a very quick proclamation. As we in Bethel, in the Bethel neighborhood, cede more and more of our neighborhood to social services, willingly, mostly, and enthusiastically, mostly. We also are aware that Bethel is short of services for the people who are not reliant upon social services. We have a shortage of restaurants, and the property that we occupy there at Four Corners had historically 3 food service facilities that only has 1 food service facility currently. So this is to you, Mr. Rakoff. As we proceed in Bethel, we will do everything that we can to make certain that the people who live there have the services that are equitable and equal to those in South Eugene and those in Sheldon and those in the other parts of Eugene and Springfield. So that being said, Mr. Chair, thank you for that latitude. I'd like to move order 21-10-12-01 to approve an intergovernmental agreement to transfer real property at Highway 99 and Roosevelt Boulevard to Homes for Good for permanent supportive housing, and to delegate authority to the county administrator to sign the approved agreement.
Is there a second?
I'll second.
Thank you. Let the record show that Vice Chair Farr has moved approval of Order 21-10-12-01. Commissioner Trieger has seconded. Is there discussion to the motion? Seeing none, Ms. Waite, would you like to call for the vote? No, just kidding. Seeing none, all those in favor, please signify by saying aye.
Aye.
Opposed? And let the record show that Order 21-10-12-01, proposed by Vice Chair Farr, seconded by Commissioner Trieger, has been approved unanimously 5-0. It's an echo here, is there not? Thank you very much, Ms. Waite, Mr. Fox, Mr. Sullivan.
Thank you.
Commissioners, I believe we are now on 5B, Lane County Fire Update. And it is our hope that Patience Winningham Melcher has been patient with us. And now, if you would, please, Ms. Winningham Melcher, give us we are yours.
Morning, Chair Bernie, Vice Chair Farr, and the board. I hope you're having a great Tuesday morning. I'm here to close out fire season. Yay for us. If I could share my screen, Diana, that would be great. I just have a short slide deck here.
You're muted. Patience, you're muted.
Seems that bringing up a slide deck mutes you.
That's why I never bring one up. We see the deck, we don't hear you.
I wish I could read her lips, but I can't. You can.
I just want you to know, Ms. Winningham, that 3 of your 5 minutes are up. I'm just kidding.
I mentioned this last time, but if we can't hear you, sometimes if you log out and log back in, we can magically hear you again. It happened just in the last meeting.
Yes, we have empirical data to this effect.
Patience, I show yourself muted. Can you try unmuting?
Thanks, Diana. It told me I was muted by the organizer. So I was like, I don't know how to do this.
And who might that organizer be? Anyway, please continue.
Thank you. Diana, that's what it looks like.
Not me.
Can you see my screen now?
Yes.
Very good. So I just wanted to recap the fire season for the year for the board. First, we'll start with the Middle Fork Complex for the group. It was primarily in the Willamette National Forest. Total acres burned to date is 30,928 acres, and that's the entire complex. So I have a screenshot here that shows the Quist fire near the footprint of the city of Oak Ridge. They're outlined in purple, as well as the Gales fire there north of Oak Ridge and closer to Mackenzie River Fire and Rescue, as well as Lowell. Containment to date is around 55%, and fire activity continues to decrease, as well as fire personnel in the footprint. The Rough Patch Complex is something we didn't talk a lot about. We breezed over it a few times, but never really got into details here. It was in the Umpqua National Forest, and the total acreage burned were 50,409 acres. And I'll call the board's attention down here to the bottom of the picture. This is the county line between Lane County and Douglas County. So the Rough Patch Complex included the Chaos Fire, which did encroach a significant portion of the Bohemian Mine. So you'll see back here behind this yellow part is the Bohemian Mine footprint. And there is some county infrastructure up there that did sustain damage, but I don't know that it's anything of significance. Again, expect decreased fire activity and fire behavior and fire personnel in the area. And with that, I'd like to say it's the end of fire season. We're moving into rainy season, which is great. Just for the board's information, I'm going to be receiving updates from the National Weather Service for rain events in the fire-burned area, the scar-burned area, when there are significant atmospheric events coming our way. So we'll get those pretty regularly, and they'll just keep us updated on precipitation that should be coming. Also, Oregon Department of Forestry declared the end of fire season on October 5th. And then lastly, I told the chair I'd like to review some of the mitigation projects that we're putting forward in emergency management and with our partners around Lane County. This is just a short list of all the projects, but of importance, the community wildfire plan. We really worked hard on doing an outreach project, so we're going to work with some of our community partners and the subcommittee to develop an outreach project with all of our logos and all of our information, and more of that will be coming. We'll also be, Mackenzie River Fire and Rescue is working on a fuels reduction project, going around and doing defensible space around homeowners' property. They're working on putting that project together now, so more information forthcoming. Lazy Days Trailer Park, Homes for Good will be initiating this for about $250,000. And that's, I'm not super privy to that project, but Matt McRae is. And Matt's leading the McKenzie School upgrade as well. So it's a $2.7 million project. And we've used this advanced assistance there, the second to the last line item, to hire a contractor to help support the compilation of all these grant applications and get them submitted to the state. We're also utilizing these grant funds to put together an update for the Natural Hazard Mitigation Plan for Lane County, which is a number of mitigation plans across the state of Oregon that the University of Oregon is going to be taking the lead on. And the total dollar amount for that project is about $215,000. These project funds are not 100%. It's a 25% local share and a 75% federal match. And I'll conclude with Lane County has submitted 11 projects total for Disaster 4562 hazard mitigation funds. And that represents all of them for Lane County to include public works and technology services. And that is the end of my presentation.
Well, thank you for calling for the end of fire season. Thank God. Commissioners, any comments or questions? Commissioner Buck.
Thank you, Chair. I just want to appreciate all your work, patience. So you've done so much there. And clearly, even though it's the end of fire season, there's a lot of work to do because there is funding out there. And it's just a matter of being able to find the right resource for the right project here locally. Are there any immediate weather threats that we should be aware of in the aftermath of the fire? And you did mention potential rain events, but it's almost, well, this morning, if I look outside, it almost felt like we skipped fall. So I was just wondering if there's anything that you are hearing or seeing that we should be aware of it well in advance.
Yeah, Chair Bernie, Commissioner Buck. The National Weather Service did release a report earlier this week, and it was talking about a La Nina season coming, which is a lot more water and more frequent water events here in Oregon. So we are working with the National Weather Service pretty closely to determine what that could look like and dusting off all of our plans. So looking at flooding, high hazards, areas of concern. But right now, nothing in the forecast. So I'm not going to jinx myself and just say we're continuing to work on fuels mitigation, fuels reduction for wildfire season for next year.
Thank you, Commissioner. Was there anything else? No. Any other commissioners? Well, if I may, patience. Thank you very much for that report. Out here in Springfield, I look out my window and it actually is beautiful. And my understanding is that there's a 70-degree sunny day forecast for Saturday. My understanding, though getting a little more serious, is that this is not impacting us. In fact, my understanding is they're anticipating a heavy rain season for the winter. But in the Southwest United States, for the first time in the history of some of these dams, like Oroville Lake, they're actually stopping the production of hydroelectricity. So it's just interesting, right, to see all these impacts, how they all interrelate with one another. But thank you very much for this report. Obviously, it's getting hotter and drier, and we're dealing with that right now.
Mm-hmm. Yep.
Thank you. Are there any other questions before the vice chair has indicated we're good? Thank you very much for the report. We are now on item 5C. I think the last report was an introduction to this one, the monthly holiday farm fire report. We have Matt McCrae, who, by the way, you were referenced several times in the last report. Program Manager, Keir Miller, Division Manager, Marianne Nolte, Supervisor. Please, we eagerly await the report.
Great, thank you, Chair Bernie, Commissioners. For the record, my name is Matt McCrae, and I serve as the Disaster Recovery Manager for Lane County. For this month's update, I'm going to provide a very brief overview of some of the key developments over the last few weeks. I'll quickly review updated charts, the same ones that you saw last month, and then we'll dig into permits in the area of the Holiday Farm Fire as you requested. So I'll be handing over the bulk of the presentation time to Keir Miller and Marianne Nolte, who are experts in this arena. Really briefly, by way of overview, Public Works is preparing to provide technical assistance to the community of Blue River as they move to develop a wastewater treatment system with dollars allocated by the state legislature. I just want to let you know that Public Works, Lane County Public Works is leaning in to support that effort with technical assistance. And Lane County is working with the long-term recovery group to develop and implement a comprehensive needs assessment that can provide us with a more complete picture of the needs of the fire-affected population. A couple more items. ODOT, you may recall that when ODOT was doing hazard tree removal, it became a big issue. They left a number of trees that were kind of questionable. They weren't sure how they were going to do. So they're actually returning now to go back for another round of hazard tree removal. But thankfully, only a few hundred trees didn't make it through the hot summer. So they're going to go back and remove those trees that didn't make it. Lastly, there was a question from the board last month about how many public dollars have been spent on ash and debris removal in the Holiday Farm fire. And so based on ODOT's figures, as of last week, they spent $14.25 million in ash and debris removal on private properties. They also spent $21.4 million on hazard tree removal as of last week. Those costs are incurred by the state.
Forgive the interruption, Mr. McCray. I've been told that you are supposed to have a PowerPoint that we're looking at, and we're looking at a bunch of notes.
I'm sorry. Oh, you're looking at notes? I'm sorry. I don't see what you're seeing. My apologies. Thank you for correcting that. Do you see the Holiday Farm Fire Recovery Update now? That screen?
I don't.
Thank you for clarifying for me, Chair Bernie.
Oh, no, I just wanted to help you. Sorry to interrupt you.
Yeah, no worries. Gosh darn it. You know, I'll stop sharing my screen because I don't want to spend.
PowerPoint, I can bring it up for you.
You know, it's short enough, and we're on a short time frame. I think I'm just gonna carry through the rest of the material, and I'll skip the slides for now because I don't think that's super important for today. So the funds that that ODOT has put out, the 21.4 for hazard tree removal and the 14.25 for ash and debris removal, were incurred by the state with an expectation of a 75% reimbursement by FEMA. And then lastly, I want to highlight that Devin Ashbridge has been recognized by the Oregon chapter of the American Public Works Association for her efforts and talents as a public information officer. She received recognition during a conference just a week ago. She, as you may know, Devin established and has managed the McKenzie Rebuilds website. She has generated a regular wildfire recovery email for interested parties. She produced regular Facebook Live wildfire updates for 8 months and coordinated Lane County resources for multiple public information forums. She's currently assisting the new nonprofit McKenzie Valley Long-Term Recovery Group by developing a logo, key documents for them and materials, and making a first start towards a website for that group. I'm not sure how, but Devin somehow routinely does the work of several people, and I just want to let you all know that I think this award is well-deserved, and just highlight the talent that we have on our team here at Lane County. I'm going to skip the data sets that I had. They were just updates from last month. And actually, I was going to propose that I just bring those back to you quarterly because this situation isn't so dynamic that a monthly update is necessarily pertinent. So my plan is to provide you with the data every month, the updated data, but only take time during about once a quarter to actually provide you the, to put that on the screen and share that with you. So curious your feedback on that, if you'd like more frequent updates on the data sets or not, or if there are other data sets you'd like to see. And with that, I'm going to turn it over to Keir and Marianne, who can share more information about permits in the area of the Holiday Farm fire. Thank you.
Thanks, Matt. Good morning, commissioners. Thanks for having us here to share a little bit of information about the permitting work that's going on upriver. I just want to kick it off and introduce Marianne Nolte to you all, and then she's going to take it over. She's got a short slide deck. Hopefully it didn't mute her when she pulled up her slides, and she'll go through that and share some of that data with you all. So as the board knows, Marianne Nolte was brought on as our Holiday Farm Fire Permit Navigator. This position was funded by the State Municipal Wildfire Assistance Program grant. That's the same funding that has brought us Matt McCray in this capacity. We're just extremely thankful to have Marianne in this role. I just want to say that she's been working for the county. She started just before the wildfires hit back in August 2020. She's been in this capacity as the permit navigator since June of this year. And I have to say that it was like a switch was thrown when Marianne was brought on board in terms of the types of issues and concerns and the number of problems that we were seeing out in the community. And Marianne's just quickly jumped into that role, really hands-on. She's got a very challenging job, both technically challenging, and of course, working with all these fire survivors has been, it's a taxing position. I think we got the exact right person in this role to help these folks out. She's very solution-oriented. I've heard really nothing but positive things about Marianne in the months she's been in this capacity. So I want to just take this very public moment to say thanks, Marianne, for all the great work you've been doing. I also want to just quickly, since the timing seems appropriate, just follow up on some of the comments that were made this morning in public comment from Ms. Staley. I listened to her comments. I also listened to the board's response to those comments. And I want to just address them briefly and state that staff has heard loud and clear from the beginning that our position is to find solutions for these folks and help them get back in their homes. That's been very clear, and that's been the direction we brought Marianne on board with. We view her in a sort of role as an ombuds person to work with these folks to find solutions. The direction she's been given is, figure out what we can do to help these folks out. And if there's an issue that you absolutely can't solve, come to me and I'll try to figure it out. So I understand that the board hears from individuals who have these very sticky widgets. That's your role, that's your position. They come to you when there are problems that they can't overcome from, dealing with staff, working with staff. I also recognize that there is a negativity bias when it comes to working with public agencies. That's just a fact. And what I mean by that is that you hear overwhelmingly about the situations that don't work out. You don't hear about the hundreds of folks that Marianne works with on a monthly basis that get through the system. And she's got some good permit data she'll share with you to show that we are making progress, that homes are being permitted and are being rebuilt. I just want to let Marianne know that I respect the work that she's doing. She does everything she can to try to help these folks through the system. There are instances where the law is the law and we can't interpret the law differently. There are instances where a variance is the only solution. It's the escape hatch that's provided in the law, and there's no amount of interpretation that can be done to get out of a numeric value like a square footage requirement or a setback. We try to help these folks to the extent we can. The board's been great in waiving permit fees. If the board wishes to waive permit fees for variances, that's certainly a policy choice that we could look into. But I will say that overall, Marianne's doing a great job trying to solve these very difficult issues. So with that, I will turn it over to Marianne and she'll run through some of the permit numbers for you. Thanks.
Thank you, Kier, and thank you all for taking the time this morning. Can you all see my screen? Okay, excellent. So as Kier suggested, I just wanted to go through some of the permit data that I've been taking a look at over the last year or so. So I wanted to start off with just some numerical data. So we're taking a look at dwelling permits just to see how many we've issued. These are holiday farm fire permits. So we have 166 total dwelling permit applications that we've either issued or that are in review right now. And this includes stick-built and manufactured homes. I also took a look at the numbers for planning permits. So we have 184 total planning applications that we've received. In the last month or so, we've closed about 23, and 11 of those have been since the passage of House Bill 2289, which makes some of those planning applications not be needed anymore. We're also looking at 361 inquiries. So these are folks who are coming to talk to us as they're starting their rebuilds. And then we've issued 75 emergency RV permits. So that's sort of a general overview of the permits themselves. I also wanted to take a look at the fee waivers. So as you know, we've been refunding people who have paid for dwelling permits and the associated septic. So those refunds have been 900 and waivers, I should say, is included in this number. So 905,000 that we've refunded or waived for building permits. And then for planning permits, we have refunded or waived 50,515 to date. So the total is 956,000. So quite a lot that folks haven't had to shoulder themselves, which we're happy about. These next slides, I wanted to take a look at the volume of permits that we've been working with over the last 16 months or so. So this chart starts off in May of 2020, 4 months before the fire started, and it goes through September 30th of 2021. So the purple bars are for non-holiday farm fire properties, and the yellow bars are for holiday farm fire properties. So you can see we've seen an increase in applications generally since October of 2020. And then we also see a couple of spikes starting in March. That was for non-holiday farm fire permits, as well as holiday farm fire properties. And then you can also see in June and July of 2021, we had quite a few holiday farm fire combo permits. And I should clarify, these are for stick-built dwelling permits. So again, spike in spring and then a pretty busy summer. This next chart takes a look at manufactured home permits. It's for the same time period, that May through September of this year. This shows a similar pattern. So there's an increase in permits starting in the fall of 2020, and then a really busy summer, both for holiday farm fire properties and non-holiday farm fire properties. So quite a few permits being pulled in June, July, and August. In addition to looking at the number of permits, I also wanted to get a sense for how long it's been taking us to process them from the day we receive the application to the day the permit is issued. So this chart shows processing times for stick-built dwellings, and this is for holiday farm fire properties only. We're able to keep track of those kind of separately, so it's pretty simple to pull the data for those. The y-axis shows the number of days that we had it in possession, and the x-axis shows the date. You'll see here that processing times are pretty consistent. Average time of 39 days, a median time of 28 days. You'll also see there are a few outliers. There are some properties that had, more than 100, more than 200 days. I checked on these. There are situations where the property owner was waiting on a planning approval to be completed before their building permits could be issued. And in a couple cases, we were waiting for information from the customer before we were able to complete the plan review. So overall, pretty consistent, about a month to issue those permits for holiday farm fire customers, stick-built dwellings. Again, same idea. This is for manufactured home property or manufactured home permits in holiday farm fire affected areas. So again, processing times are pretty consistent with stick-built homes. It's under 30 days. The longer processing times this summer really coincide with those high volumes of permits that we were seeing in June and July and August. And then the last chart that I wanted to share was the same idea, but this is for planning actions. So again, these dots represent the time in possession just for holiday farm fire planning applications. So these would be things like floodplain verifications, riparian declarations, verifications of conditions before people can apply for a building permit. You'll notice the high possession times this late summer. There were quite a few applications that we had in process since the fall. And as we've gotten staffed up, we've been able to catch up with those slower permits and get those closed out. And then also of note, with the passage of 2289, which in a lot of cases eliminates the need for these planning applications, we're seeing fewer PAs to be processed in the first place. So if you notice between April 15th and June 30th, there were about 30 applications that we were working on. For the period between July 23rd and September 11th, there are about 22. So we really are seeing less volume, but the times are fairly consistent with building at about 38 days to a month. So that's all the slides and data that I had to share. And at this point, we are happy to take questions about any of it.
First of all, thank you so much, Mr. McCray, wherever you are, and Mr. Miller, and Ms. Nolte. Is that how I pronounce your last name?
Yes, that's right.
Thank you. And your presentation demonstrates all the amazing things we've heard about you are probably true. Although I would not ask the board for questions on anything. I think we.
Fair, I'll restrict it.
Commissioners, any questions or comments? Commissioner Bozovich.
Thank you. First, I just want to really appreciate Marianne Nolte. I have pretty close connections with a lot of the local building industry and building professionals, and I have heard nothing but great feedback since she's come on with the county about her work out there. So I just want to really appreciate your work, Ms. Nolte. You're getting A's from everybody I talk to.
Thank you.
That all said, going back to Ms. Stanley from this morning, and I keep rereading House Bill 2289. There is nothing in that bill that talks about building setbacks if you're building within the existing footprint. It's almost a must issue, as long as you're not going more than 10% over that, and you're generally within the existing footprint. It doesn't say, oh, but if that existing footprint's over a setback, you have to get a variance. Kier, can you?
Yeah,
I'm at a loss.
Sure. My understanding is she's proposing not to build in the same footprint. My understanding is that she was won or awarded a new house, and it may be sized differently. There's issues with the existing drainage lines for the septic system where the home needs to be reoriented. So it's not in the exact same footprint. It has to be slightly altered. That's my understanding. Is that correct, Marianne?
I'll add that the size is actually, it's over that 10% mark as well. So if it had been within 10% of the previous dwellings, you're right that we wouldn't have had to take a look at the setbacks. But where it was larger than 10% or more than 10% larger than what was there before, then it isn't eligible for House Bill 2289. And then we had to bring it in through our kind of standard process, which does look at the setbacks.
And that 10% is based on the footprint or the floor area?
It's the footprint.
Okay, because the bill says floor area. But that's because that's where we got into a discussion on in another board meeting about footprint and definition of footprint. But yeah, I just want to, wherever we can try and make that work, because it definitely says wholly or partially within the footprint of the destroyed building, not exact. So, if we can make that work for Ms. Stanley, we should try.
Thank you, Commissioner. Was that it, Commissioner? Okay. Yes, Commissioner Farr, and then Commissioner Butt.
Thank you, Chair Bernie, and thank you, Kier, Ms. Nolte, for the presentation. I'm looking at the last slide on the board, and you said that the planning process is 28 to 30 days, but I see a whole lot more dots above the 50-day mark. Where does the 28 to 30 days come from?
Sorry, that's our median time. So the average is correct. Your 55 days is our average. The median is 38 days. So what I meant was it's pretty consistent with the building approvals. So the building approvals are right around a month. The planning approvals are a little bit over a month.
For the average, which still leaves a whole lot of people outside of that. Without going into details as to the messages that I actually have on my phone here, and I'll pass them along to you. As Commissioner Bozovich said, Ms. Nolte, all indications, all accounts are that you are doing a superb job, and I want to thank you personally for that, and thank you for the people that I have spoken to at the river who really, by and large, appreciate the job that you are doing, and think that you are really stepping beyond boundaries and exceeding expectations as far as speed of your work. So thank you for that. And I'm not going to go into too much detail. Now's not the time for me to talk about individual cases, but I will pass these along to you, and I would love to maybe set up a time, Mr. Miller, where we can sit down and help me to be able to say the right things to people who have the sharp criticisms of how long it's taking up the river for them to get their planning approved, to get their permits approved. Because I would love to be able to not just nod and say, I'll pass that along. I'd be able to actually provide some more detailed information. And perhaps you and I can spend 15, 20 minutes sometime just so we can give me the right things to say, because I'm interested in doing that, Kier. I really am. I believe your work is your work, YEO work, that is really very difficult at this point in time. And for you to take criticism from areas that it's not warranted, I hate to see that. I hate to do that, and I want to not be a part of that. So thank you for that. The last thing I'll say is regarding footprint. My footprint is where my foot touches the ground. Doesn't matter where my arms are. And I hope that we can work with that as our definition of a footprint. If my arms are sticking out, it's not part of my footprint. So the footprint is where I touch the ground.
Yes, that's the interpretation that we're taking.
Did you hear that, Commissioner? That is the interpretation that they're taking. Oh, thank you.
I did. So the Frank Lloyd Wright cantilevers that stick out way past where it touches the ground, that is not part of the footprint. Thank you.
Sorry, if I could just jump in real quick. I'll just say this is one of those areas where we're trying to be as liberal as possible, where it makes sense to interpret it in that way that helps an individual out. We are with the floodplain discussion where sometimes a cantilever footprint is going to provide more opportunities. We're looking at that as well. And I think there's going to be a discussion today about that footprint question to try to resolve that. I know that that's something staff has been looking into.
Thank you. Thank you, Vice Chair. Commissioner Buck.
Thank you, Chair. I just want to publicly congratulate Devin Ashbridge. She is so deserving of that award. She goes above and beyond. And, there's just so much of this public communication that was so critical throughout this past year. And she is spot on every single time. So congratulations, Devin, well deserved. Marianne, I think you are the most popular person upriver, hands down. And so we're really blessed to have you on board. Thank you for all your work, and we need to, clone you somehow.
Thank you.
On Ms. Stanley's comment earlier, we know each other well and been trying to help the community. She is a staunch advocate for helping people rebuild, and it affects her as well as she rebuilds. She's just 3 feet too long, according to the current rules, and that's just so frustrating, right? Because we can't always rebuild in the exact same size as the original home. And when you're that close, or I should say just 3 feet too far, it's so frustrating for that individual. So it's helpful that we'll be continuing to have these conversations and meetings at the board level. I hope there is a way to help her in our department work through this without costing an arm and a leg. The processing part is the most frustrating part for people who are rebuilding. Thank you, Chair.
Thank you, Commissioner. Commissioner Krieger, you're the only one who hasn't spoken yet. I don't know if you want to.
Thank you, Chair. No, I'll just appreciate all of the staff, the whole team of 3 before us, and all the many people I know that are working alongside and behind them to make this happen. And I'll appreciate the graphics as well. They were graphically illustrating, right, how the vast majority of folks that we're serving are getting service within a totally acceptable window of time. And those outliers are outliers for a reason, and each one is different. And that's what makes those take a little extra time and effort and attention. And so I appreciate knowing that we have such a strong team working to serve everyone who's applying for rebuilds upriver and community wide, and just really appreciate the graphics were very, very helpful for me in understanding the picture of what's happening. So thank you so much for that.
Thank you. Oh, Commissioner, Vice Chair Farr.
Thank you, Chair Burnett. Just one thing regarding rules. You know, rules are in place most certainly, but rules are designed when opportunities present themselves to look at the rules to see if they make sense or see if they can be adjusted or changed for posterity, so that the rules aren't negatively affecting people's ability to live their lives. Some of us were elected to change rules. When we have opportunities like this, we should look at the rules and see how they can and should be changed in order to facilitate once again the ability of people to live more comfortable lives and to live within their means. Thank you.
Thank you. Ms. Nolte, yes, your graphics were graphic and insightful, which isn't always the case. First, I want to thank you, Mr. Miller, Ms. Nolte. I think you provided a common sense, real world, real experience demonstration that, yes, in fact, you're being as liberal as you can regarding interpretations, with the understanding that the clients in need, the people in need who've lost their homes, come first. So I thank you for that. Ms. Nolte, I think were that not the case, we wouldn't have so desperately sought for and been blessed with the position which enables you to do what you do. So the data and the information, I think, was excellent. Mr. Miller, I have, like others, I'm on the receiving end of complaints, and I want to point out that you've always been available to me when that's occurred. We've always been, the responsiveness of your department has been really quite good. Complaints will continue. People will always have issues that don't fit neatly, even within all the changes and accommodations that we've been able to do, and I'm sure we will do more. And Ms. Nolte, you pointing out that during COVID, during a time where the operation of the county has lost revenue, and nonetheless, we've made decisions about expending reserves specifically to get more of those doors back for people. You've also demonstrated the dollars that we've foregone, what normally in this operation would have been $1 million almost, specifically to take that burden away from those rebuilding. So I really, from my perspective, thank you both so much. And in that, we're also acknowledging, I don't quite know the fit other than all of Devin's work with this issue, but sorry about this. So my wife first knew Devin as her journalism teacher at Cottage Grove High School. I first knew Devin at Edgewater Furniture because I bought a piece of furniture from her when she was working there. And I think it's safe to say that she has surpassed her teacher and her customer by leaps and bounds. So it's tremendous to acknowledge that she received that acknowledgement. And Devin, wherever you are right now, congratulations. Commissioners, are there any other questions on this report or this agenda item at this time? Mr. Miller, Ms. Nolte, Mr. McCray, are there any other comments you would like to make to round this out?
None for me, Chair. Thank you very much for the time. And thank you to Kira and Marianne for presenting and helping fill the commissioners in on the situation. Much appreciated.
Well, thank you all very much. Your break is over. Get back to work. We, I believe, are now on item 6, consent calendar. Is there a motion to approve the consent calendar for October 12th, 2021? Vice Chair Farr.
Chair Bernie, I move the consent calendar for October 12th, 2021.
Is there a second?
I'll second.
Let the record show that approval of the consent calendar for October 12, 2021 was made by Vice Chair Farr, seconded by Commissioner Buck. Is there discussion to the item? Seeing none, all those in favor, please signify by saying aye.
Aye.
Opposed? Let the record show consent calendar moved for approval by Vice Chair Farr, seconded by Commissioner Buck, has been unanimously approved, 5 votes to 0. Forgive me. We are now on item 9. County Council. It's my understanding Council is busy and has no announcement. Whoops, I'm sorry.
Chair Bernie, I believe we're on item 7, Health and Human Services.
Are we on item 7?
Another test for me in the absence of Steve Mokryski.
Yeah, Steven just told me I messed up. You're very polite about it. Thank you very much, Mr. Rickoff. And I apologize again. Item 7, Health and Human Services, Order 21-10-12-11, in the matter of approving 2 contracts and 4 amendments, delegating authority to the county administrator to sign the approved action. And we have with us Ms. Gaffney, and I apologize, Ms. Gaffney.
Good morning, Mr. Chair. I will not take it personally at all. And I'm happy today. We have, as you know, what is often a routine item around contracts and amendments. We do have 2 new contracts that are on that list that I might lift up for you. And then I'm happy, of course, to answer questions about any of them. In this particular order, we include 2 contracts for water assistance programs. In the past, the commissioners know we have done a lot around low-income energy assistance, and these 2 contracts, one for EWEB and one for the Springfield Utility Board, are for low-income water assistance programs, which we're excited to roll out as part of our work to help people meet their basic needs as we move through this post-pandemic, during the pandemic process. So those are the 2 I would lift up for you. And then, of course, we also have a series of amendments that are in this packet as well. Believe that presentation is within my 2-minute limit, Chair Bernie, so I'll turn it back to you.
I won't take that comment either. Are there any questions or comments from commissioners? Yes, Vice Chair Farr.
Chair, I'm prepared to make a motion.
Please.
I move passage of Order 21-10-12-11 in the matter of approving 2 contracts and 4 amendments, delegating authority to the county administrator to sign the approved actions.
Is there a second? Okay. Thank you, Commissioner Trieger. It's been moved by Order 21-10-12-11, has been moved by Vice Chair Farr, seconded by Commissioner Trieger. Is there discussion to the motion? Seeing none, all those in favor, please signify by saying aye.
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 Opposed? Let the record show not only were we within our 3 minutes, Ms. Gaffney, but Order 21-10-12-11, moved by Vice Chair Farr, seconded by Commissioner Trieger, has been unanimously approved, 5 votes to 0. Thank you very much.
Thank you all.
Mr. Rickoff, it looks like I tried to skip a whole bunch of stuff, huh? We are now on item 8, Human Resources. 8A, Order and Resolution 21-10-12-12, in the matter of establishing a new job code for the classification of program manager and adding pay grade D62 within the non-represented position-based salary range. And we have with us to present this, Ms. Myra Fodor. Ms. Fodor, I hope I pronounced that correctly. And I see Alana Holmes, Senior HR Business Partner. Whomever is going to begin this, we're yours.
Chair, Commissioners, I believe that would be Myra.
Right.
Not sure if there's a difficulty. I'm going to talk right over and.
Ms. Holmes, for some reason, your voice is illegible. It's muffled. And forgive me, maybe it's my eyes, but I don't see her on the call.
Myra is on the call.
Okay.
Let me see if I can.
Myra, can you speak? And I'm not sure if you can hear me any better now. I'll be right back.
Commissioner Buck, it looks like your advice is being taken again.
And it does show that Myra's on the call. I'm wondering if she could say a few words so we can hear her.
The mic feels it's muted.
Yeah.
And we keep saying on the call. Isn't that a turn? This is in a meeting, right? In a public meeting, no less, yes.
I am honestly, I don't know where I have technical difficulties. Can you hear me?
Yeah, your last
You
few.
can hear me, I cannot hear you.
Yes,
That's a wonderful combination. I was going to have Myra come and speak and present here, but if we can't hear you, that's not going to work either. That is strange that we're both having issues.
Alana,
Chair,
I'm wondering if you can hear us now.
If you would like to move to the next item, I will troubleshoot with Alana and Myra, and we can return to that one.
And I am presenting, kicking off the beginning of the next item.
Okay.
So can you hear me now?
Yes.
And I can hear you. All right. So we're going to go with this item first. If you want to come sit over here and then we'll go from there.
Okay, allow me to introduce it if I may, Ms. Holmes. So we're in our normal chronological way. We're doing 8B first. 8B is order 21-10-12-13 in the matter of amending Lane Manual Chapter Code 2 to add limited duration positions and provide health insurance provisions for said provision LM 2.190, LM 2.300, and Ms. Holmes, we have Ms. Holmes, I believe Ms. Nagels, and Ms. Wood to provide this discussion.
Chair, Commissioners, thank you. Alana Holmes, Chief Human Resources Officer. Basically, Lane County has identified a need for an additional type of position within its labor structure so that we can provide depth and flexibility to meet a variety of staffing opportunities. And as you all know, the labor market and town acquisition these days can be quite challenging. So such additional agile staffing strategies will enhance the services to the community while also balancing fiscal responsibility. In order to respond to the ever-changing workforce, the board is being asked to approve adding limited duration positions to 2 types to the Lane manual. The packet we are presenting to you today includes changes to the Lane manual for the addition specifically of that limited duration position type. And we really are excited about the variety of ways that this type of position can be used to fill in gaps, to help serve grant needs, to provide developmental opportunities for employees, for limited project and pilot project needs. We've seen other organizations that utilize limited duration positions to create opportunities to better serve their communities. Indeed, I have been with another organization that has utilized these types of positions with great success. So we look forward to that conversation with you today. And what I'm going to do at this point is turn it over to Inga, and she's going to walk you through more specific information. Inga.
Thank you, Alana. Thank you, Chair Bernie and Commissioners. We, as Alana said, we are very excited to present this packet to you today. The request is to add limited duration positions. It's primarily been driven by our departments who are seeking flexibility within the workforce. With COVID-19 and wildfire response, we've seen emergent needs that could be addressed by hiring personnel for a specific period of time. Limited duration positions are intended to maximize resources, funding, and opportunities and will not replace regular FTE. That's not our intent. If the requested changes to Lane Manual are approved, Lane County staff will work to develop policy under the APM Administrative Procedures Manual to define the use of limited duration positions. Some of those provisions include to backfill behind temporary assignments, including coverage in emergency operations centers or employee development opportunities, project-based work under grants or explore new programs and community initiatives, flexibility to utilize positions for longer than the current 520 or 1040 hours up to full-time for a period of no longer than 24 months. If a regular employee accepts the limited duration position through a normal recruitment process, not as a development or temporary assignment opportunity, they will not be able to return to their previous position. We really see this as if someone is interested maybe at the end of their career to utilize a new project or a new community initiative, and then they're looking to potentially retire from the organization, but it's not to necessarily replace our regular workforce or to move folks out. Health insurance and related benefits will be provided similar to what we currently provide for our part-time employees, including employee-only health and dental insurance with the option to purchase full family coverage, access to only the high deductible health plan, coverage under life and accidental death and dismemberment insurance, and access to our Live Well Center. Additionally, employees in the limited duration positions will have the option to join the deferred compensation program and purchase short or long-term disability insurance. Limited duration positions will be eligible to accrue and sell time management at the rate applicable to the APM or appropriate collective bargaining agreement for the classification in which they occupy. Employees will be eligible for any applicable COLAs and merit increases, and Lane County will pay the employer and employee contributions to PERS for eligible persons. If this is approved, departments will be able to begin recruiting for non-represented limited duration positions upon implementation of the Administrative Procedures Manual. Bargaining units will have the opportunity to bargain the impacts of these positions prior to implementing the policy for the classifications they represent. So we will have to complete the bargaining process for those specific classifications under the CBAs. And with that, I will open it up for any questions from the board.
Well, thank you very much, Ms. Wood and Ms. Holmes, and the technical expert. Anyway, I'm sorry. I'm noticing 2 Inglewoods on my screen. I apologize. Are there any questions or comments from commissioners? Yes, Commissioner Trieger.
Thank you, Chair. Thank you for the presentation. This is a really interesting and seemingly just gives us more, the ability to be more nimble to fill different roles. And I'm just curious, I was just looking through the materials and didn't see anything. Is there anything that specifically prohibits the extension of a limited duration position and or that limits any one individual from taking multiple serial limited duration positions so that their time with the county is extended beyond, but is, you know, each position is limited to the scope of the position for which they're hired, if that makes sense as a question.
Yes, thank you. Chair Bernie, Commissioner Trigger, great question. Currently, we did set the ability for these limited duration positions at the 24 months, at the 2 years. And so that's what we're really looking at for, you know, that project work, filling in obviously emergency operations centers, temporary things. I think at the point of what we discussed, and this was an entire panel of department directors and others that worked on this packet, can't take credit for the work there. But what we discussed is that really after that 2-year mark, we should be looking at potentially, you know, a regular FTE if that work is needed to continue. And then we would open up for those recruitments for that regular position, but really limiting it at that 2 years. However, we did not discuss about the multiple limited duration positions. There is nothing barring anyone from applying for multiple limited duration positions and extending their time and employment at Lane County.
Great, thank you. I guess what I'm thinking about is I could imagine if looking back, somebody being hired for a limited duration position based on something contextual to COVID. And of course, we didn't know what would be going on. So we might say it's an 18-month position, but then guess what? It's more than that. So I didn't know. my question was getting at whether it can be extended within the period up to 24 months or, just anything. So we don't box ourselves in. So the person can actually be successful and complete the work in the amount of time, because sometimes obviously circumstances beyond our control make the work take longer. So just asking for if we've built some kind of flexibility in for ourselves to be able to do that. And that might just be a second limited duration position of a 6 month to tack on is why the second part of that question of whether one person could have multiple limited duration positions sequentially. So great. Thank you very much. Appreciate it.
Thank you, Commissioner. And I want to call out an apology to Ms. Nagels. I literally saw Ms. Wood's name on your screen and my mind blanked out. So I totally apologize for that. Are there any other commissioners with questions or comments on this item?
Commissioner, I apologize. Diana Jones is just pointing out that I must have logged in to the meeting under Inga's login, and I have no idea how that happened, so I apologize.
No. I'm apologizing. Let's get this straight. I'm apologizing to you. But thank you very much. Any other questions or comments? One question, if I may, Ms. Wood. So is there a trigger at which point a person's going to stay on longer that was in one of these positions, that depending upon the job, right, and the classification, that triggers them be covered by one of our collective bargaining agents? Yeah, do you see what I'm trying to say?
Yes. Great question, Chair Bernie. So in fact, it's a little bit different than that. The work and the type of work, because we have specific 520s and 1040s. 520s traditionally are not represented by the collective bargaining agreements except for under our 626 agreement. And then 1040s are represented, those temporary positions, in our collective bargaining agreements, and it's about the work that's assigned to those classifications and represented by that staff. So we today are asking you to add this into the lane manual, and we can establish the non-represented work under limited durations, but we will in fact have to negotiate the impacts of this for that work that's covered under all of the classifications in the collective bargaining agreements. So they wouldn't necessarily transfer from a non-represented position to a represented position. The work is separate.
Right. Thank you very much. Any other commissioners before we ask for a motion? Vice Chair Farr.
Thank you, Chair Bernie. The motion, I move Order 21, 10, 12, 13 in the matter of amending Lane Manual Chapter 2 to add limited duration positions and provide health insurance provisions for said provisions, LM 2.190, LM 2.300.
Thank you very much, Vice Chair. Is there a second?
I'll second.
Thank you, Commissioner. Order 21-10-12-13 has been made by Vice Chair Farr, seconded by Commissioner Buck. Is there discussion to the motion? Seeing none, all those in favor, please signify by saying aye. Aye.
Aye.
Opposed? Let the record show that Order 21-10-12-13 made by Vice Chair Farr, seconded by Commissioner Buck, has been approved unanimously, 5 votes to 0. Ms. Holmes, Ms. Nagels, and Ms. Wood, thank you very much.
Thank you all so much.
All right.
We now move down the agenda to item 8A. We'll keep our fingers crossed regarding technology. Let me reintroduce it. Order and Resolution 21-10-12-12 in the matter of establishing a new job code for the classification of program manager and adding pay grade D62 with the non-represented physician-based salary range. And we do have with us, although it says Alana Holmes, I'm going to guess that this is Ms. Myra, is it Fodor?
Yes, thank you, Chair Bernie. Good morning, and my apologies for the technical difficulty. Chair Bernie, Commissioners, I am Myra Fodor, Senior HR Business Partner for Lane County Human Resources, supporting Health and Human Services. I'd like to present you a board packet in the matter of establishing a new job code for the classification of program manager and adding pay grade 62, D62 within the non-represented physician-based salary range, and then return the floor to you with questions. Currently, Health and Human Services employs physicians as associate medical directors. However, due to recruitment difficulties, there is a need to allow for alternatively credentialed individuals to be eligible for this type of role, typically held by a medical doctor. There is also a new trend emerging in which credentialed nurse practitioners and physician's assistants are filling professional roles with responsibilities similar to the associate medical director, supervising licensed providers at designated sites, partnering on site-specific issues, and supporting community health center initiatives. Therefore, the impact has been analyzed to consider expanding the minimum qualifications to include nurse practitioners and physician's assistants, and create a job code and salary grade for assistant medical directors. The approval of a new job code and salary grade will provide Health and Human Services the ability to recruit for assistant medical directors credentialed as nurse practitioners and physician's assistants to assist with oversight of the community health centers. Creating this new job code and pay grade will help ensure the classification accurately reflects the variation of responsibilities and decision-making required between the physician level associate medical director position and the nurse practitioner physician assistant level of assistant medical director. Furthermore, the addition of the job code and salary grade reflects the growing trend in clinics extending those roles to be credentialed as nurse practitioner or physician's assistant. Human Resources recommends amending the job codes for the classification of program manager and adopting the proposed job code of N3005N and salary grade D62. Chair Burney and Commissioners, thank you for your attention. I return the floor back to you.
Well, thank you very much, Ms. Fodor. Commissioners, questions or comments? Seeing none, Vice Chair Farr.
Thank you, Chair Burney. First, I'd like to comment to Ms. Fodor. I really appreciated your guide to Tuscany. It helped me a few years ago navigate the country. Without Fodor's guide, I do not know what I'd have done. So I would like to move, you hear that all the time, I apologize for that. I'd like to move order 21-10-12-12 in the matter of establishing a new job code for the classification of program manager and adding pay grade D62 within the non-representative physician-based salary range.
Thank you, Vice Chair. Is there a second?
I'll second.
Thank you, Commissioner. Order 21-10-12-12 has been moved by Vice Chair Farr, seconded by Commissioner Buck. Is there discussion to the motion? Seeing none, all those in favor of the motion, please signify by saying aye.
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 Opposed? Let the record show that order and resolution 21-10-12-12 moved by Vice Chair Farr, seconded by Commissioner Buck, has been unanimously approved, 5 votes to 0. And thank you, Ms. Fodor. You are the first person that's given such a strong presentation that there's been little discussion whatsoever. Thank you very much.
Thank you, Chair Burney. And Vice Chair Farr, I will be working on my Lane County Fodor guide coming soon, just for you. Have a great afternoon. Thank you.
That's not fair. That's not fair that it's just for him. Just letting you know. Okay. I know, Vice Chair, of your time. We're moving as quickly as we can. We're now on item 9, County Council. Council informed me this morning he would be busy and there were no announcements, but Mr. Dingle, if you're here, any announcements? I don't expect you're here. Okay. Item 10, County Administration. 10A, discussion, report back on land acknowledgement for board meetings and recommendation for community engagement and next steps. And we have perhaps the last time in this role, Mo Young, Equity and Access Coordinator, and Greg Rickoff, Director of Operations, please.
See what we can do to bring this in 15 minutes. Mo, take it away.
We're going to do our best. Can you hear me?
We can hear it loud and clear.
Sweet. My audio has been not cooperating. Good morning, commissioners. I want to start with apologizing for failing to remove the language in the board packet saying that we would be recommending that y'all use a draft land acknowledgement statement. I thought that I had taken it out in all of the places and I did not. So apologies for not deleting one of those references. I'm just going to do a quick reminder of what the assignment was, and then I'll go through my process and make a recommendation. So on June 15th of this year, you all requested that staff look into ways that we might incorporate a regular land acknowledgement into our meetings, public meetings generally. This request was made because it's important to understand the history that has brought us to reside on this land and to seek to understand our place within that history. Once the assignment was made, I talked with local partners who work in other public agencies. I posted in a portal that the Government Alliance on Race and Equity hosts to see what my colleagues across the country are doing. I talked with some of those colleagues, and I also spoke with local experts. And what I learned out of all of those conversations really comes down to just a couple of points. One is that a land acknowledgement is a good first step, but it has to be a first step. Additionally, it's really important that we don't take that first step until we know what our second step will be. And so what that looks like, I hope in Lane County is that we'll do some trainings with local experts on land acknowledgement statements and intergovernmental tribal relations. I have 3 dates that are set aside in the evening, November 10th, November 18th, and December 3rd. We made sure that it was 3 dates so that you all could attend and participate and not have a quorum. It wouldn't be a public meeting because no more than 2 of you could be at one session at once. And then I also recommend that county staff that work with community broadly, as well as staff who work with advisory boards and committees, also attend one of those trainings. My recommendation is that you attend the workshop that works best for your schedule and decide in a work session then what you would like your second step to be. And then once that's been decided, you work with tribes that are here locally. And a reminder, there are 7 tribes that Lane County is a service area for. And you come up with a land acknowledgement statement together. And then I just wanted to remind that I've done the work to get the training scheduled. I would like to attend one of the trainings, all of that, but I don't know when an update will come to you all, because that's really going to depend on how quickly an equity manager and an equity and access coordinator are hired who can provide the required staff support for an item that's really this big. This is something that we should do intentionally and take the right amount of time to do. So hopefully I saved some time for you all to react.
You're fine as long as you got everything that you decide we need to hear.
Yeah.
Okay. Comments, questions from commissioners? Commissioner Krieger.
Thank you, Chair. Thank you so much, Ms. Young, for the presentation and for those words at the very end about doing this intentionally and thoughtfully. And I'm fully supportive of it taking however much time it takes for us to do it in a way that not only do we arrive at something that is really right-sized for us, but as you said, puts us on a path for the next step and the next step, because this is ongoing, iterative work, and also most importantly that we don't embark on it in a way that causes any further harm. So really appreciate you bringing this back to us. And often we sort of scratch at the surface of something and then we start to see how big it is when we open it up. And so not rushing is a really important lesson that we're not often very good at, sort of societally and culturally. But so I really appreciate you bringing this to us in a way that lets us sort of learn better how to take our time to do a thing that allows for it to form its own, to take its own shape instead of us deciding what that shape is and trying to stuff the work into it. So thank you for that. I will look at my calendar and email you of those 3 dates that you mentioned, which one works best for me, and really look forward to digging into the work and seeing what we learn along the way. Thank you.
Thank you, Commissioner. Yes, Vice Chair Farr.
Thank you, Chair Bernie. And Mo Young, I want to say thank you for this work. It's indicative of the type of work that you've given to the county in your current role. And we will miss you in that role. But I wanted to say this. At the Public Health Advisory Committee meeting yesterday, your name was mentioned often regarding your new position. And I wanted to let you know that the folks over there really, really, really appreciate that you're going to be joining them in your new role. Congratulations on that. And thank you once again for this work and all that you have done for Lane County.
Thank you.
Thank you, Commissioner. Yes, Commissioner Buck.
I appreciate too, you know, the two commissioners have already said what I would also, but I too want it to be meaningful. A land acknowledgement and some action behind it makes a lot of sense. So I appreciate you setting up those meetings. I too will see which one I can be at. I think it's really important we be there and we hear what they have to say, and then figure out what our residents and what our tribes would like us to actually be working on. That's really important for us to know. So thank you.
Thank you, Commissioner. And yes, Commissioner Bozovic.
Thank you. I am supportive of moving ahead with this work, provided that we, as we work towards this, we get a full understanding of the history of the land occupation of the Pacific Northwest and the anthropology behind that. I believe that we skip over a lot in recognizing just the most recent occupants of the Pacific Northwest. Kennewick Man and the ties to the Kelp Highway, the movement of peoples across Beringia and the DNA studies that have been done. There have been multiple peoples that have populated the Pacific Northwest over time. And, you know, the recognition that this is not, you know, that we're just we as Western civilization that moved in is the most recent wave of migration in the Pacific Northwest and displaced these people in sometimes pretty horrible and atrocious and violent ways. But the people we displaced other people. And, you know, 400 years after Columbus, we're still enslaving each other in wars. So as long as we have a full understanding of all of that, educating our land acknowledgement, I'm happy with that. But it seemed, I just don't want to have a land acknowledgement that does not understand the full history and anthropology and migrational movement of the human species in the Pacific Northwest.
Thank you, Commissioner. And that would include, I think, the most recent migration of people from Maryland, correct, to Oregon? My only question is this, and forgive me, I don't mean to demean it, but anything we do should be intentional, right? And anything we do should be with meaning. Ms. Young, are you going to make sure, if we don't have understanding a process organically as you're prescribing, we will go through, and that will inform next steps, right? And doing a proclamation is a first step, not a last step. Or at the same time, if we don't have some suggested next steps, not that we would take any of them, but if we don't have some suggested next steps, there will be there won't be, in my experience, enough structure to actually take action, not quickly, but to take action at a point. So I guess my question is, will staff be providing some optional next step thoughts in addition to this process?
So I can give you an example of a next step. An example could be that you all meet elected official to elected official with folks from tribal councils in the 9 federally recognized tribes in Oregon, plus the ones that border us in Idaho, and create MOUs about how you'll work together. That could be a next step. My hope is that staff will provide guidance through this whole process. I won't be that staff person, however, so I can't make comments.
Yeah. I'm sorry, I didn't mean to interrupt.
Sorry.
Mr. Rickoff.
Chair Bernie, we can make that commitment. You know, I think that will fall on Steve Mokryski, myself, Judy Williams, the individual as we fill this position. But Mo Young is absolutely right. There'll be government to government connectivity. And as is in the report, there are a number of initiatives within Health and Human Services that are really requiring government to government consultation around issues of behavioral health that will push us forward. So it's not only do we have suggestions, I think we're going to have some mandates if we're going to be able to qualify for state funding.
Thank you very much. Any other commissioners? I have so much more I want to say, but I would not live through Commissioner Farr's wrath. So no. Ms. Young, is this the last time officially at a Board of Commissioner meeting we will see you in this capacity?
I think I'm coming to talk about the equity lens next week. And
in that case, I will withhold all my accolades. Thank you very much for this report.
All right. Have a wonderful day.
You too. We have, Mr. Rickoff, are there any county administration announcements?
Chair Bernie, can I save announcements for the end of the day, perhaps with review assignments, so we're not taking the time now that it's noon?
Only if Commissioner Farr approves.
And I'm expected late at HSC, so whatever, of course. But acquiescence, yeah.
Thank you, Vice Chair. Yes, Mr. Rickoff, absolutely. Thank you. We have no executive session this morning, although we will this afternoon. Commissioners, it is noon, and we are recessed, and we will reconvene at 1:30. And thank you all so very much. See you in a bit.